Hello everyone, I'm Martin Garcia, and I'm part of the Media Access Marketing Department for SCAA. Welcome back to our YouTube channel to watch another informative advocacy and empowerment program. Now, if you haven't subscribed, click that subscribe button and give it a like, as it will help move our channel forward so we continue spreading awareness to the general public about sickle cell disease through our social media. Today's session features Pat Corley. In her session, she'll be going over igniting awareness, increasing knowledge, and self-advocacy directed at quality care, personal perceptions of good care, medicines and treatments, PTSD and stigma, and strategizing success for better care. Now, without further ado, let's move on to our AEP session.
I just want to welcome you all to today's AEP meeting. The first thing we're going to do is a little moment to arrive just to get us all centered. I know we're all in different spaces. Most of us are, at home as we've been for many months. So I want to do an exercise all together to get us on the same level. So I'd like for everyone, please, to sit up straight in your chair or however is comfortable for you, and close your eyes. Take a deep breath in and out. In and out. With your next breath, I want you to focus on the feeling of the air entering your nose as you breathe in. And out. With your next breath, I want you to focus on your chest rising as you breathe in. And out. And let's take 3 breaths together in silence. And I just want you to focus on whatever noises you hear in your own space. And now, once you've finished your last breath, take a moment to slowly open your eyes and adjust back to the group. Thank you so much for doing that moment to arrive with me. And it's just so special every Saturday that we do this to have this connection with everyone.
Ms. Pat Corley, you have the floor.
Good morning. So actually the topic of my presentation is going to be increasing knowledge, igniting awareness, and supporting self-advocacy directed at quality care. And I want to share the way that I got into the sickle cell arena was I actually stumbled into it. I was working and I volunteered at the sickle cell camp here in LA. And I met Dr. Cage Johnson there, who recruited me, who actually tricked me into coming on as his nurse and giving up a position that I was being paid more money for, to work with the sickle cell population. And I let me just share that I have no regrets. It's the best job I've ever had in my life. So I just want to talk a little bit about the topics that I'm going to try and cover today are Sickle Cell 101, personal perceptions and good care, stigma, PTSD, and strategizing for better care. On the Sickle Cell 101, next slide, I'm not going to spend a lot of time talking about that because you guys know about sickle cell disease. You know that there are 100,000 people in the United States who look in different ways who have a form of sickle cell disease, and that sickle cell disease is actually an umbrella term for a group of red blood cell disorders that affect hemoglobin. So it's a multi-organ disease. It's autosomal recessive is the way that you get sickle cell disease, and that people with this disease have hemoglobin S, which can cause the distortion of red blood cells into a sickle shape or a crescent shape. So some of the things that make it unique is that it is a genetic condition, that it is it's inherited, it has potential for very serious complications, and that it's very unpredictable. And so with sickle cell disease, you have hemolysis, you have vaso-occlusion, you have pain, you have organ damage, and you have a multitude of problems related to psychosocial issues and experiences that patients with sickle cell disease have on a regular basis. So next slide. So the thing that I really wanted to make sure that we focused on is that because sickle cell disease is such a devastating condition, and until now we had very few treatments or very few services that we could offer people with sickle cell disease, we now have a number of new drugs that are going to make a difference, and people will be able to redefine how their life with sickle cell disease is as a result of using some of these medications. And so what I really want to do was encourage you to take advantage of utilizing these medicines because they're new to us, they're pricey, but I want you who live in the sickle cell disease to realize your worthiness, for having the opportunity to change how you speak about your life and how you live your life. And so I want to encourage you to look into all of these medicines, Oxbryta and Dari, Adacvio, hydroxyurea, as well as stay on top of the movement in stem cell therapy, gene therapy, and bone marrow transplant. And I want to encourage you to make sure that you go out and vote so that you can vote on the bill that's going to be up for stem cell in California this year. So those of you who live in California, I want to make sure that you vote and that you not just vote for president, but vote for a cure for sickle cell disease, because it's going to make a difference for many, many people who live with sickle cell disease. Okay, next slide. So we're going to talk, I wanted to talk a little bit about sickle cell care. And I really want you guys to really talk more than I talk on this, because I wanted us to get a feeling for whether you're currently receiving care for your sickle cell disease and whether you feel like it's good care, and whether you feel like you get good care in the emergency room as an inpatient, or whether you feel that we as healthcare providers understand what you need from us, and whether we provide what you need for us related to treatments, to pain and your medication, to you and your needs, and just to help us kind of sculpt what you think would put you in a better place. I'm asking you to at least share with us 3 things that you think would make your sickle cell care better and would make ultimately care and guidelines better for people who live with sickle cell disease. So I'm just going to open it up so that we can do a little discussion on that with your sharing what you think.
Nice.
Can I say something? I'll say
Yeah.
something. Okay, this is Janelle Show. I think that when a patient goes into the hospital, like any hospital, to the emergency room, that there should be a phone call to the doctor that they see, to let them know that, hey, your patient is in a hospital, and that way that they could get, good care. Because I always communicate with my doctor to let them know that I'm in a hospital. But, say I'm like really sick and I can't call her or let her know that I'm in a hospital, I feel that the doctors in the emergency room should let it be known that their patient is in a hospital, because a lot of times the doctor that sees the hematologist that sees the patient don't know that the person has been in the hospital at all. And the more communication that a patient receives between the doctors, I think the better care that they can receive at the hospital. Because, the hospital treats you, but they don't follow that patient. So they don't know what really works for that patient. So I feel that if they do like have better communication with the doctors that they see on a regular basis, that maybe perhaps their care will be better. That from my experience.
So I absolutely agree with what you're saying. And we've got a lot of other comments that have come in. And I think that, I don't know whether many of you guys have seen that new article which came out, When Actions Speak Louder Than Words, Racism and Sickle Cell Disease by Alexandra Power Hayes in the New England Journal of Medicine. But that would be an incredible article for you guys to actually look at and read, because it speaks to medicine being a mirror for injustice in our society, and how it has it's a field riddled with racial disparities in everything from research funding to patient care to life expectancy, and that there may be no population of patients whose health care outcomes are more impacted or affected by racism than those with sickle cell disease. So it speaks to a lot of issues that we experience in the sickle cell community, and that cause patients so much trauma when they come to our emergency rooms, because they encounter doctors who know little about sickle cell disease. Many of them in their whole entire training have never even encountered a sickle cell person that day. And so I think it's important for us to really make sure that there's more awareness, there's more knowledge, and there are guidelines for managing sickle cell disease, and it's imperative that we share those guidelines, so you as a person with sickle cell disease has access to those guidelines so that they can share them with folks as they encounter them, so that they know how to better treat people with sickle cell disease. I recently had an experience that I want to share about. I was invited to sit on a panel discussion, and the people that were involved in that were a group of people who were dealing with opioid use disorder. And so I wasn't really sure why I was invited, but I had to really qualify my participation by saying that sickle cell disease is not a disease that has an opioid use disorder problem. And so when the person who was hosting it actually said to me, her husband was an emergency room doctor, and participation of the sickle cell segment on that panel changed how she looked at people with sickle cell disease, because she always felt that they had a lot of drug problems. And that was her reason for inviting them. So thankfully, we now have a presence in that population that can make a difference. So does anybody else want to share anything related to their sickle cell care, or what
just really quickly, Pat, for everybody on the call, the link to that article has been posted in the group chat area, and I'm working on getting it out onto our website shortly.
Great.
Thank you, Pat.
Great.
I in response to what Janelle said about having about contacting your doctor for a better experience in the emergency room, that prompted a question in my mind, or thought in my mind, about in the event that you're just having a ravaging crisis, that maybe you could pre-establish for your emergency contact, to contact your physician, and maybe have that physician know that that's your emergency contact for such a situation, where, like, for example, my son would be the one that would probably be taking me to the emergency room and could call my doctor, and if she knew that he would be the one, that might be another option along that line.
I got a question. This is Calvin. Is it possible to, when you hand your doctor, or if you go to the emergency room, is it possible to have a card that states that you have sickle cell and give you instructions what to do? So like when you hand them your medical card, you can also hand them that card at the same time and give them further instructions. Is that possible?
So you know, unfortunately, it is possible, but unfortunately, patients do that a lot of times, and they still, you know, they still don't get the care that they should be getting, even though they share that information. I just talked to Wanda Sherney, who is in the Detroit area, and she has just developed a card that she gives to the patients, and that card has a link directly to a line where they can call, and information is given to them automatically about sickle cell disease. But unfortunately, many of the healthcare professionals don't utilize that. And somehow we have to work harder at making sure that that becomes mandatory for them to change the way they interact and the impact they have on lives of people with sickle cell disease. So Nadina, you look like you're gonna say something.
You could tell, huh? Well, you know what? I want to try to, I don't know if you were going to speak on this or not, but I want to better understand, and I think that people living with sickle cell need to better understand, what is the whole premise for My Chart, that whole software application that's supposed to be, that's available now, that they've been, you know, exposing, or they've been promoting over at San Francisco General, and I'm sure it's like in a lot of different places. So, you know, like, because just very quickly, we're developing journals that have all of their background information in there. We're setting up templates in the actual journal so that the person, when they're in the hospital, all that information is right there. They've got it listed. Their transfusions, the whole 9 yards. We're not just giving them a book with blank pages. We're giving them a book so that they can fill in that information. So it's just like Shirley was saying about a card. So if I go in with this, with my journal, and I've got my history, you know, somewhere in there, it needs to be mandatory that they pay attention to that. Or what use then is a pain program or a pain plan or any of that other stuff. I'm just trying to figure out what My Chart is about.
You know, when I first came into the sickle cell arena, and I was at LA County USC, there actually was a program at that institution where when you put the patient's name in, it popped up that said they had sickle cell disease, and this is who you should contact, and this is what should be done for those patients. I don't know how we lost that, but it definitely, whatever we do has to be mandatory, because people, if you give people choices, they're going to choose what they want to do. But if we can make things mandatory, we can certainly impact the way people with sickle cell disease are treated, you know, or there will be, at least there'll be some way of holding them accountable for what they don't do. It's accountability that really makes the difference. But I kind of want to explore, because there are people on this call that have sickle cell disease. Do any of you guys receive good care, as you define good care, from the facility that you attend? And what is it about that person who provides that care to you that you think we could actually clone and make other folks better by paying attention to that?
So I can jump in real quick. My name is Elon. I'm actually a social worker with Contra Costa County. I'm the community health worker for SCAA. So I don't believe that I have good care. I'll start with that. But I think the reason why is because the things that need to happen at a legislative level. People aren't going to do what they don't have to do. And like you said, if you can give them information, but they still have a choice about whether or not they want to use that information. And for me, like I get ticked off with the ER experience because it's too much explaining. I don't mind having to explain to an intern that's there to learn, but when that intern is the only one listening to me, I have a huge problem with that. And I feel like a lot of the sickle cell patients, if physically able to do so, need to be participating in the training process of these doctors before they become doctors.
Absolutely.
That's my 2 cents on it.
Yeah. Carolyn?
Thank you. So I think what Nadina said, Elon stated as well. So here's all good points. Here's what's happening. Last year, we actually did begin the process at the seminar of speaking about the guidelines that currently exist. And we began the conversation as to how we would make sure, at least in California, how we would make sure that this becomes law, so that at least, just like for stroke or heart attack, that there's a set way to be able to go in and go through the procedure. At least if we can make sure that the guidelines are available in every hospital where they get reimbursed to be able to treat you. This is what we began speaking about, and what we're going to what we're going to continue to speak about in 2 weeks at the seminar, because exactly what Elon is saying, that it has to become legislative in order for them to, they should want to follow the protocols that exist. But the fact remains is that, as Pat said, they don't have to. If they don't want to, they have their license, which allows them to do what they want to do. But what we're asking people, the physicians, to do is to follow the protocol that will save your life, period. Not to do what they want to do, but to follow the protocol, to follow the guidelines that will save your life, that will save my life. And this is what we're asking for. So you guys are right on time to say that. And we're just hoping that as we move this needle forward, that we can count on you all to be part of it, because this is exactly what we're doing. We're trying to get guidelines in place that will be mandatory throughout California. And again, hopefully this will reverberate throughout the US and at a national level. But we're just, right now, with California having the worst mortality, we're focusing on California to get this done. Thank you.
So Adrian.
So on that note, because I've been doing a deep dive into this now for many years. It's not that we want our lives saved, right? It is that we want good treatment. Because if we go in saying we want our lives saved, they're going to say, "Oh, right, prove it." And so I think we have to make, in making the point that the quality of our life is as important as us having a life. And where the confusion comes in when they're talking about value and what's important and what's not, docs, they're always looking at whether or not you're living. And so I think in our discussions, we must also make it clear that we are talking about having good care, right? And having quality care, and that the quality of our life is as important as us having a life.
Absolutely, because we all know that when we talk about sickle cell disease, it brings immediate judgment related to who you are and what you actually have to offer as a person living with sickle cell disease. And so it is important for us to really change the conversation that's going on, in and around the sickle cell community, to making people understand that people with sickle cell disease have value, like every other person living, and I think that's something that's missed oftentimes. People just assume that people with sickle cell disease are sick people that are just at home and are using the emergency room and are costing them a lot of money, and they don't understand what people with sickle cell disease bring to the equation or bring to the table. And so I think it's important for us to do that. And that really comes into the next slide, which is talking about stigma.
Hi, Pat. Actually, can I say something? Sorry.
Yes.
Can everyone hear me?
We can hear you.
Oh, okay, perfect. I got in the chat that, yes, I get good care from my doctor, Dr. Cynthia Martel of Keck, USC. She is informed and has many sickle cell patients. She updates me on options and whether new drugs or are appropriate or not for me while still giving me choices. I get great care at Huntington Hospital once admitted, but the ER has not been good experiences. I will try, as I have once in the past, to get a direct admit, but that's difficult if a crisis occurs outside of office hours.
So one of the things on that, Mervyn, one of the things that I want to share, that happened to me recently. I had a brother that had cancer, and one of the things going to one of the hospitals, they have a fast pass card. So people who had certain complications did not have to spend all the time in the emergency room. They took their card and they were seen immediately. And I think that's something that should be applicable with sickle cell disease. I think we really need to look at something like that, because I think that could make a difference in terms of experiences that people with sickle cell disease have with our emergency room and the doctors we encounter. So it's great that you get great care. We want that for everybody with sickle cell disease, and we just have to figure out how we can move the barometer, the needle forward, and so that's what I always want us to focus on what stigma is, because stigma really plays a large part in the experience you guys are having in the emergency room. From the time you walk into the emergency room, there's already the process of judging going on, biases that people have related to sickle cell disease, the devaluing of the population, because stigma is an attitude or a belief that something is that may not necessarily be what you believe. And in terms of health conditions, there is bias. Coretta Jenneret and Cheryl Brewer, who are very close friends of mine, have done a lot of research on that. And they share all the time about how people with sickle cell disease are discriminated against.
Pat?
Yes.
So is that, obviously, so the reason why I'm bringing this up is because Sickle Cell Anemia Awareness of San Francisco is going to be starting their outreach program very soon.
Yes.
And what our goal is for our outreach program is to target the post-med or post-grad med students, or those types of programs that are helping these young aspiring adults learn more about this field, but then also getting them to start being interested in these types of diseases, these hereditary diseases, bloodborne pathogens, and so forth. Why do you feel like it is a stigma? Is it because of the color that's associated with sickle cell, or is it just the ignorance? Or because we're trying to figure out how we can develop a curriculum so that these students can start incorporating sickle cell and hematology into their learning experience. So go ahead.
Yes. So I think it's a combination of all of those. I think there's little exposure to sickle cell disease. First of all, I remember being in nursing school, and I think I may have been exposed to sickle cell disease one time in that whole period of time. And then talking with doctors, they have never even seen, on many instances, Dr. Johnson, who said to me in his whole medical career before coming into the sickle cell arena, he had seen one person with sickle cell disease in medical school, post-medical school as a resident, and as an intern. So he saw one patient. So I think it's lack of exposure to the patients. And then there's also difficulty with people who, and I shouldn't say this because I'm old too, older folks in the profession who have thought all along that people with sickle cell disease don't really, they stay at home and suffer. They don't really contribute. They overuse emergency rooms. They die early. So there really nobody's really invested in sickle cell disease until now. And so I think it's lack of exposure. One of the things that we do at USC in the medical school is the introduction as a second-year medical student. I think early introduction to people with sickle cell disease, and one of the things when I was new to the sickle cell arena that we had developed was a program where the medical students, first year medical students, were first introduced to sickle cell disease by coming into the clinic setting and meeting people and following them, you know, so that they got to know who that person with sickle cell disease really was. And so what I found was those students that we had exposed very early on had a different outlook on who people with sickle cell disease were, as opposed to those folks who go through in their fourth year medical students and then are exposed to sickle cell disease. So I think we have to expose the students to sickle cell disease earlier so that they develop a healthy opinion of who people with sickle cell disease are and how they can better help them to focus on living the best life they can live with sickle cell disease. So I think that's really what happens.
And then the last thing I wanted to ask, staying on this topic, was, so, you know, we talk about in school, I used to be a teacher for PE, and we talked about like how children have certain behaviors that they bring to school because they're probably learning it at home. And it's more just a simple fact that the family might be ignorant to certain things that are going on to help this child with a better experience behaviorally going into school. So that translates also to my question about with the childcare, with the children that have sickle cell, like, is there also a disconnect, do you feel like, that the medical profession is having with the parents that are bringing their children in? How does that dynamic work?
I absolutely think there is a disconnect, you know. And I think when you give somebody a diagnosis at newborn screening, and you know, and then they start doing research and they find out that people may sometimes die early from sickle cell disease, but they don't find out about those people that live well into their 60s and stuff. Right. So you're living a life where you're always, you know, children with sickle cell disease are born into pain, and they have the potential to have pain and some suffering all of their lives. But also parents, I think we don't focus on all the suffering that parents do as a result of having a child with sickle cell disease. So I think it's imperative that we begin to educate people from a standpoint of really sharing with them that your child can live well with sickle cell disease. They may have interruptions in that journey, but that does not mean that the journey has to be a journey of hopelessness.
Right.
You know,
I had a question for Nadina, actually. So Pat, I think you might know kind of our story. My brother died in 2013 at the age of 37 from this. And just kind of keeping within that idea, I wanted to ask Nadina, like, when you were dealing with my brother when he was 10 and 15 years old, did you feel like you were expressing yourself well enough to the doctors about this particular situation? Or obviously, possibly you didn't have as much knowledge. What do you feel like, Nadina, with your experience as a parent, talking to nurses and doctors about my brother's situation?
Well, you know, when you ask, well, see, one of the key things you said in that statement is when they're 10 or 15 years old. That's, you know, they're getting the best care when they're young. You don't have much difficulty when they're children. It's when they make the transition is when they get lost. And, you know, I was fortunate enough to educate my son to learn how to represent himself if I wasn't there to assist him. And, you know, he began to recognize what he needed to do in order to get what he needed while he was there suffering, if I wasn't there for him. But for the most part, when they're young like that, you know, there's really no issues. It's when they transition is when the services you know, they're lessened. The resources are less, the places that you can go, your insurance changes, everything, you know, changes once you move into that adult area. So, I don't have any complaints about the care that he received all the way up until he was like 20 years old, because we just happened to had a really good doctor. But once, you know, they say that they can't take care of you anymore and you've got to be in the adult area, then everything starts to change.
If I can interject real quick, Yemi has been wanting to say something about stigma.
Yes, she did, and I was going to say that too, but I didn't get that in. But yeah, Yemi wanted to talk, but I think Mervin is handling that, so maybe he was going to say that. I don't know, but yeah, she had a question about stigma.
Okay,
but did I answer your question, Antoine?
to Antoine's question.
So Adrian actually wants to comment on what you just commented on
Okay.
Medina, as a mom with a child with sickle cell.
So I think Antoine was spot on about the need for, I'm sorry, the need for more education for the parents. I think that for the longest time, we as parents, we get the diagnosis, and then so we're very focused on keeping the child alive and getting good care, but we've been doing that in a way that we are not really educated on the disease and really what it's doing to a body, I think.
Yeah, this is true.
So again, because the medical profession is very much concerned about whether, you know, or not you're alive, right, particularly as a kid, and doing what they could do, which for a long time all they could do was control the pain. And third, they didn't know a whole lot about the pathophysiology of sickle cell. So I think that now that we know more, that there really needs to be a concentration on parent education, so that you start with the whole mindset that not only are you addressing the child's pain crisis, right, but you are addressing the whole child. And now that we have treatments, we have, how can I put it? We have more alternatives than just thinking about keeping our child alive, right? But we have now treatments that can keep them healthier and more optimally prepared for the life to come. So I think definitely that I used to say the transition starts when the parent gets the letter that says the child has sickle cell. There's not been a whole lot of emphasis put on those first 5 years, but first 5 years, we know what do children learn first 5 years, right? They get a lot of their personality is shaped, a lot of their thoughts about the world, their eating habits, their reading habits, all of that. So I think you hit right on it, that first 5 years, I think, needs to get really a redo. A redo. I'll let you go back to stigma.
Absolutely, and that's
let me say this too. I think that during the course of my child's growth, there was a sickle cell organization, a community-based organization that, you know, really gave me a lot of information, tapes and literature, and, you know, but there wasn't any real counseling about the whole, how do you counsel or how do you assist the whole person. You know, they always address the pain. It's always like that's their main focus, when they forget about the whole person, which is the reason for the Advocacy and Empowerment Program, you know, along with trying to become better advocates for yourself and others. It's trying to get the medical professionals to see the people living with sickle cell on a different level outside of the hospital, and get a chance to experience the real person, the whole person, not just the person that comes in with pain.
Right.
I think
and so yeah, and not having any CBOs here in the Bay Area, you know, once that CBO left or closed or whatever, then, you know, you just kind of, excuse my language, ass out. So, you know, then you got to try to rely on the hospitals and the institutions to help you, educate you, and all the rest of that.
So I think that's why it's so important to have parents like you and Adrian, who have raised children with sickle cell disease, who can share those experiences and who can illuminate the walk that people who have young children with sickle cell disease are going to experience, and not just the parents, but for the whole family, because sickle cell disease is a family disease, you know, and it's a disease that impacts every single little nook, you know, in that family, and it's what we have to learn how to do is how to do that better, you know, and how to shield and protect the whole family from the damage that sickle cell disease does. The pain, the suffering, the loss of finances, all of those kind of things need to be considered as we walk the sickle cell walk that we have to.
You know, that's the
Yummy,
reason.
Yummy, you got a
One of the
question?
things that what we should be doing is
Oh.
advocating for sickle cell centers. When I was a pediatrician in Oakland, we had genetic counselors, we had social workers, we had Marcia Treadwell was a psychologist, and every single one of those patients, families that come in as a family, they would talk to each one of those people. They might spend more time on a visit with the psychologist or the social worker than they did with me, because that's what's more important to them. And if you don't have that education and empathy for the family and understand how, what Pat's saying, everybody in the family, including the extended families, aunties, grandparents, everybody is completely freaked out when a child with sickle cell disease is born, and they all need to have good education and they need to have understanding. And those kinds of things happen in sickle cell centers, but now without those centers, there's no place for anyone to go really to get that kind of care. And we used to see people maybe twice a year who didn't live around Oakland, and they would get that kind of thing. The other thing that was really amazing were the sickle cell camps.
Yes.
We had residents and fellows come to the camps, and that's where they got to see kids with sickle cell disease being kids, which, you know, they never got to do that because the only time they saw them was when they were in the hospital. So
the
that's
camps,
just a comment. I just don't know what we do for getting that back to where it was.
The camps are important also because the doctors and the nurses got some training in those camps. We learned what it was to be with a person with sickle cell disease 24 hours a day, you know, and I think that's so important. We used to recruit the medical students from USC to go to camp with us, and that's where they learned about sickle cell disease. So there are so many things that we're missing now that we had, you know, my thought was that we were going to get better with sickle cell. And at this point, I think we're better in some areas, but some of the things that we really need to value and some of the things that we really need to share, we've kind of lost that. And I think we have to come back to, like Keith said, real sickle cell centers that can provide for the needs of our community, our sickle cell community, not just the person who has sickle cell disease, but the people who surround that person and whose lives are affected by you know, having a family member. And even the judgment that goes on when a family member has a child with sickle cell disease, because you knew sickle cell was in your family, you know, all of that kind of stuff we need to get back to looking at very differently and trying to change the conversations we have about what sickle cell care looks like and how we can better take care of people and their families with sickle cell disease.
You know, we need to take the focus off of the medications in some way. I mean, everybody's focusing on it. We've got all these new medications, everything's going to be better, but you still have sickle cell disease. And these medications are just medications.
They're just medications.
They're going to make your life better, but they're not going to change your life.
Well, I kind of disagree with that. I think the new medication.
I think we have to get back to
I'm not talking.
put more value on the patient rather than, and focus rather than the focus on, oh, how many new meds can we get and this kind of thing.
Right. So
Can I stop you, Pat? I'm sorry, sweetie.
Okay.
Can I stop you? My apologies. But Yemi, did you have something to say? Because I may have ran over into your time. If you got something, you speak up, please, right now.
Yeah. So I wanted to talk about what my son go through in school. Like every time he's not able to go to school, like I see his friend texting him that, oh, you are sick again, like being funny. I find it very, I'm always sad whenever I see that kind of messages on his phone, like somebody making fun of him. And because of the stigma, I personally, I can't even tell my mom that my son has a sickle cell. None of my sister knows that my son has a sickle cell, because I know the way they treat people with sickle cell in Africa. Once they know your son has a sickle cell, they don't want to, you can't even get married to that child, except the family doesn't know. So it's so hard for me when my sister was sharing a story about a friend that the daughter has a sickle cell. So she was like, the way the mom treats this child, like she sent her, the child is just 10 years old. She does everything, lay the bed, clean the house, wash the dishes, that the mom doesn't like this child because she has sickle cell. And I look at myself, I said, I was trying to educate my sister that you try to educate your friend that sickle cell, it's not something that people should dislike that child. That I couldn't tell that I have a child with sickle cell. And this is my younger sister, that we're the same blood. So the stigma is just too much. In my church, I can't tell anybody that my son has sickle cell. So I don't know what we can do about the stigma. It's just too much. So that's my story.
I feel like our narrative has to change about a sickle cell life. I think, I know with my brother, my mom, and the two cousins that came up at the same time as my brother, the whole emphasis was really, really on controlling his pain, and somehow if they just kept him alive until he was 18. I think that as he became an adult, and many of those children who benefited from the early protocols, we didn't have any research going on about what happens when you become an adult. And then we had a big emphasis on AIDS and then cancer. And so I feel like unlike some other diseases where when they look at them, they look at that whole life progression, that with sickle cell, we didn't have that. We have like two distinct populations, children and then adults. And so they were looked at separately. I can't tell you how many moms just really hated their adult providers because their kids were so much healthier with their pediatricians. Yeah. And so many pediatricians I talked to who were like really pissed off at the adult docs, right? Because their kids were healthier. And the adult docs who were really pissed off in the other direction because they felt like the kids had been too babied. So I think that in this whole thing, we need to look at the whole, again, back to educate the pediatric docs on the life cycle, right? And have the adult docs look at the life cycle so they can say, well, these are things that even as a young child you should look after. And I also think that the pain is for so long was the, use this term, hallmark, where all we could really understand was the pain because we didn't know. And so back to, again, this whole idea of education of really what's happening. And I feel that the new meds are transformative. They're not a cure. They're not a cure, but there's something that then allows me to be more proactive in life rather than reactive. Because I really feel like we were always reacting. We did some proactive stuff, like with the swimming and trying to keep them in the right temperature, right? And we did things like keep them in when it was flu season, that kind of stuff, but it was all reacting to everything. Where I feel the new meds will give us an opportunity the first time to be more proactive about our cure.
Right. So let me just thank you for sharing, because that was impactful, But then I want to share that you're not the only person that I've ever heard or experienced that said that. We had people when I was a nurse in the Sickle Cell Center. Their families knew nothing about their child with sickle cell disease, and sometimes when I would meet them out in the public and they didn't want me to share that they had sickle cell disease. And I think it's really, really important, the awareness and the sharing. But I also think that mothers, like the mother you described, oftentimes who it seems like they're really being mean to that child, that's their way of distancing themselves, because they truly believe that that person is not going to be around. They don't want to become real attached to that person because they're not going to be around. And the best they can do is keep them close to them and at least, you know, have them do something that makes a difference. And so I think that we're looking at it, you know, from very different standpoints. You know, that mother may just be, as I was when I first came into sickle cell. I didn't want to do sickle cell because I had heard people died because they had sickle cell disease. And then what was amazing is that I met so many of my schoolmates who had sickle cell disease who I didn't even know had sickle cell disease. And so the sharing of that information should be something that you shouldn't be ashamed of doing. And so we've got to change our conversations to help people to understand that. And then we also have to change the conversation pediatric doctors have about adult practitioners and adult practitioners' response to that pediatric population, because I can tell you that I've heard over and over again, we don't want to give our patients to the adult doctors because they're just going to die, you know, when the reality is that there's so much damage by the time they're handed over to the adult doctors that you can't go back and reverse all that damage. But certainly the new medicines may offer us an opportunity to prevent some of that damage and to make life different for people with sickle cell disease as a result of that. So I guess we probably, does anybody else have anything that they want to share on that?
I have a few questions in the chat. So one question I can follow, it's what has caused this leap in interest in sickle cell disease? And I have a following question after that.
Caused this new interest in sickle cell disease?
Probably money.
Well,
and a little bit more visibility on the part of the sickle cell population, because before, people with sickle cell disease, and that from the time I came into this arena, I used to say that people with sickle cell disease needed to have a voice. And so they now have a voice. And so some of that is people looking at folks with sickle cell disease and giving them some value now. Whereas before, there was no value attached to being a person living with sickle cell disease other than you were going to live until you died. You know, but now people with sickle cell disease have PhDs, they're MDs, they're doing things. And that gets me back to the book that I shared earlier on, A Doctor in a Patient's Body, that if you guys have an opportunity to read it, it's really good. It's by Dr. Simone Eastman Uwan, and she actually did not learn she had sickle cell disease until she was a second-year medical student. And she became ill. So I think visibility, and I think acceptance that people with sickle cell disease have value and that they are going to live longer than what they lived before.
but I think there's also something else that gets overlooked in that, and it is that we as Black people were not in positions of power to affect anything. And so what also happened in the last 15 years is that we got people like Alexis Thompson, who was head of ASH. We got people in the FDA. When I was a kid, there weren't Black people in the FDA. I used to dream of going to do talks and speeches at the FDA. And my first visit there, I mean, I could tell you. But because of times changing and opportunities, we were people who cared, knew the disease, and were committed, were elevated, I guess that's the word, acquired positions of authority in the organizations that could help us. And I think the science was always kind of happening and failing because of, you know, the pain being an endpoint. That was a problem. But I think really it wasn't until Alexis and got into ASH and she came into it really, really committed. It wasn't until people who had been neighbors with people with sickle cell who were not Black people, but had close relationships, came into positions of power. And I think it all kind of like like a perfect storm for us. So I think that gets overlooked, but I really think that definitely had something to do with where we are now.
Well, I think this evolution really began even before Alexis came on board,
Right.
because Alexis was, when we had the first 10 sickle cell centers, she was one of the docs that was just in training and coming through that process. And then she got a seat at the table,
That's what I'm saying.
And when she got that seat at the table, she was able to, propel us to a different level. So, and then I think that we just see a lot of folks with sickle cell disease that are doing meaningful things now, that so it doesn't look like everybody just dies by a certain age, because I know back when I first came on board, my thing to patients was, because they all had a magical number that they want to die by. And I would always say to them, you're going to live until you die. Now you got to make the best of life while you're here, so that I think that we really have somewhat changed the way we speak about things, but I think that we need to continue to elevate that to a point where people with sickle cell disease know that you have importance, and families of people with sickle cell disease know that, you didn't make a choice to have sickle cell disease, but now that you're here, you're going to be a force to be reckoned with. And I think that we have to push to the forefront more people who feel comfortable with their voices. And we also need to be training folks who are behind, who can also be elevated to make a difference, and as a nurse, everybody knows I'm a nurse I'm a child from the 60s era. And so I really believe in pushing forward. People don't give you what you ask for. They give you what you make them give you in a lot of instances. And so that has to be the direction of our sickle cell movement. And we have to expect that we be given what we really need and not what somebody is willing to give us. I think because of our acceptance of things in the past, we haven't got what we really deserve because we were willing to accept less. My ex-employer used to say to me, people pay you what you think you're worth. And so I'm just saying, the sickle cell community, you have a strong voice now, and you have a lot of supporters behind those strong voices. And now we just have to show up and show out, So I guess we probably, I'm not sure what time it is now, whether it's time for us to take a break or whether we can just go on. Are there any other questions that anybody wants to ask right now or share?
I wanted to ask my apologies. I apologize. Jason, you mentioned somebody in the chat. Can you advise us who that person is?
Yeah, that's Nadine Burke-Harris. She's the California Surgeon General. Her clinic is here in San Francisco in Hunters Point on 3rd Street, called the Center for Youth Wellness. And they screen children for adverse childhood experiences, which are chronic conditions, seeing any trauma in the household, dealing with mental health issues. But she is a big proponent of childhood development and protecting and preventing these adverse childhood experiences. And so as we talk about stigma around mental health, and we talk about support and supporting each other and speaking up, we now have someone in office appointed by the governor as of 2019, who is a Black woman, Bayview Hunters Point Center for Youth Wellness. So talking about and directing the state on these very conversations we're having right now.
Thanks for joining us.
Yes, Jason Gant is our resident mindfulness and wellness coach. And we'll be featuring a lot more of him in the future because he provides this type of resource that not a lot of people get access to. So thank you again, Jason, for that.
Yeah, no worries. Thank you.
Mervin?
Also, he was a presenter in July.
Yep, I was in his class.
Okay, or August.
Yeah.
So since we're kind of talking about conversations, one of the things that I really want to mention, and that, can we go to the next slide? So there's a term that's used oftentimes that when I was actually practicing, I used to get in trouble for all the time. And that term is when people would say the word sickler, I would automatically have this, and even when I say it, have this response to that term. And so I just want you guys that have sickle cell disease to share what you think about using that term, because for me, it's a term that to me diminishes who you are, by identifying you with the disease. But tell me what you think about that.
I mean, this is the first time. This is the first time I've heard that word, but I can definitely see it being used negatively and to like hurt, malicious versus anything else. So it takes me back to when I found out that I had the sickle cell trait, and I was actually in high school on a Spanish immersion trip, and so I was out of the country and got sick. And Yemi, to your point of your story about your son, even in high school, everyone was making fun of me, and I had who I thought were friends not believing me. And even when I'm in the hospital bed, and so I see or I hear my classmates using this word and like making fun of me when like I ended up having a surgery and having my spleen removed because of it. So it feels hurtful, and it takes me to a place that is uncomfortable in high school, where I was made fun of for being sick and not knowing what was going on with my health.
The term for me is basically the N-word. It dehumanizes a person by using the term. And when a person uses that term for themselves, I think oftentimes it's out of not knowing that it's actually a dehumanizing, it's a dehumanizing term. And we have to get in the practice of, in my opinion, correcting those, whether it's providers or others, when they use that term, because it's almost like the N-word. Even though people may call that themselves, doesn't make it right. So therefore, for me, it's very dehumanizing. It depersonalizes you when they're speaking about you to their colleagues.
For me, I actually, even though I'm 64, I've only been in the sickle cell community in the last 3 years since I moved to California. And I didn't know that was a derogatory term until it came up in our support group meeting for LA this Thursday. So I actually had referred to myself as a sickler, not knowing that had a negative or derogatory or condescending connotation, like I said, until Thursday night. But like I said, I hadn't been in the sickle cell community for most of my life.
On that note, I've been having conversation with people in England, and they do refer to themselves as sicklers. So yeah, so it's kind of interesting You just found out here we think it's not a good thing, and I just found out that there were places where it's considered, I mean, you know, the right thing. So it's very interesting about that.
So-
It all happened on the same day.
So does their treatment line up with the treatment that you get here for being a sickler?
So what we have learned is that people with sickle cell are mistreated all over the world. So, and it doesn't matter. I mean, if they're in Turkey, if they're in the Middle East, well, Middle East is a little bit different, but many of the Eastern European countries, I mean, yeah. And so, but as far as that term, now I don't know if that term there, I imagine being put into called a disease is not a good thing, right? And so it keeps you from being individualized. But I don't know that they've thought about it in the same way that we have.
So I'll be okay with that term when they call everybody with a disease by that disease.
Hold on, I have a question. Why does the term bother us so much? If we're allowed to be called sickle cell warriors, right? It's September, it's Sickle Cell Awareness Month. Okay, cool. It's the same thing as the N-word from the way you guys are describing it. It depends on the group of people that's using it. So if you got a problem with your doctor calling you a sickler, that's, in all honesty, in my opinion, that's a personal choice right there. I would take pride in being a sickler simply because of the fact of I have sickle cell. I'm doing what I got to do with it.
So in the healthcare system, the word sickler, when you hear that as a nurse, when I was working as a nurse, when I heard the word sickler, as soon as that term came up, it was like, oh, they're here for drugs. You know, they come in all the time. They're frequent flyers. Oh, they're malingerers. They're not going to go home even when we give them the drugs. Oh, they're going to manipulate the system. And conversation after conversation with healthcare providers, I've heard the same thing over the years. And I've been in the arena for probably 40 years now. But those conversations were always the conversations I had in regards to adults living with sickle cell disease. You know, even once I came in as the sickle cell nurse, if I walked into a room and they were talking about sickle cell, they were talking about sicklers and how, you know, how they present it to the healthcare system.
What I'm understanding is that word is coming with a stigma, and that's the problem. That word brings the stigma that we're a certain group of people that want a certain group of things.
It doesn't just
I understand that, but here's my thing. We're going to have that stigma regardless. Whether you find out you had sickle cell from when you were born or you found out years later, we're going to have a stigma put against us. So if we're going to have that stigma, I'm looking at it like, okay, let's own it. There's plenty of people with sickle cell that are in the hospital once a year, twice, and maybe twice. There's other people with sickle cell that's there every single week. We're going to have a stigma. We're going to have people look at us crazy. The only thing that's going to change that stigma is if we change ourselves, if we change what we're about. If we get more unified and we're putting it out there, we take the word and we make it our own. But if we allow them to keep the word and continue to put that stigma on us, we don't get anywhere.
And I'm hearing what you're saying, Robert. I think, though, I believe that we need to correct them so that they will not, so that I hear what you're saying. We can only be offended if we allow ourselves to be. But I think what Nurse Pat is saying is it is derogatory in how they're identifying us. So we need to either correct them or have them, just like other diseases, when they're referring to them doing grand rounds, they don't say a Cancerian. We now have a Cancerian person. They say we have a male person, age 40, diagnosed with sickle cell, not a sickler. And so I think that part of it is to help correct. Why is it that they don't do this for other diseases, but they do that for us? I think it's about us correcting them so that we too are not dehumanized like their other patients with other diseases, so that when they're presented at ground rounds, we also are given an age, a sex, a particular race, for instance, not quote sickler, end quote, because that's almost like the end all, and that is not who we are. We are not our disease. I'm a female who happens to have it, but I'm also a whole person with other things going for me, and you are too. And I want them to refer to us as a whole person and not one name that identifies all of us the same.
Black male.
So, you know,
So if that's the case, why are we in hematology?
the other thing with that is I don't know where that word came from, but it's white doctors calling Black patients sicklers. And it's very, in my opinion, it's very derogatory. It's just, you're not acknowledging that patient or individual is a person, they're a sickler.
You can say.
I've even seen it in medical literature. They use that term when they write a paper, but I think when you have to think that probably started in the 50s or 60s, whatever. There were no Black doctors. It was white doctors calling Black patients sicklers. And to me, that was just not okay.
So it boils down to profiling.
I can understand all of that. I don't disagree with it. I don't disagree that we're discriminated against and that a lot of the things are stacked up against us. I'm fine with all of those points. However, this comes back into what I'm saying. Instead of letting them take it, why aren't we doing something about it? Why are we in hematology with the other cancer patients? Why do we share our month with somebody else? Why is it that we can't sit there and differentiate ourselves from everyone else? Because until we do that, that's exactly what's going to happen. We're going to continue to have a stigma. We're going to continue to have to share. There's barely any sickle cell resources as it is. I went to California. I liked it out there. I had to come home just to sit there and get basic care. And now I'm finding out people in Texas, people in Carolina, there's people all over the world going through the same crap that we go through. We're not doing anything different.
I'm hearing you. I'm hearing you. Which is why we have to keep. We like you said, we have to keep. We got to keep moving. We got to keep. That's why awareness is so important. That's why when you say, why do we share hematology? Actually, it's actually oncology for cancer. So you're right. Why do we? I don't know if you mean why do we share the same floor? I don't know if you meant that.
Floor, department, month, resources. There's a long list.
I see.
When I was coming up, we had a separate division for sickle cell. We had a sickle cell floor. There were doctors that went and studied sickle cell. All of my doctors have dispersed to different parts of the world to in turn continue to research it. But since they all disbanded, the care has not been the same. We've had to share just to get the basic amount. We've had to combine ourselves with the cancer centers, combine ourselves with their resources. And great, cool, it's helped in some ways, but the end game is there's nothing to sit there and say that the sickle cell patients are doing anything different from everyone else. We're still getting the leftovers. We're still getting the hand-me-downs. We're getting anything that's extra, and we're being told to be happy with it.
Exactly. I think that's what Nurse Pat was saying, that isn't satisfactory. And so we do need to move the needle on that. So you're absolutely right. I think that's what she said earlier, that they give us the crumbs, and in the past we accepted it, but no more. And so you're correct. We do need to continue to advocate, which is what Nadina is doing. We need to empower. We need to change the needle. And I believe that slowly we are. It just probably hasn't come fast enough.
I'm glad to have a greater awareness about that word. Is it, just to throw a monkey wrench in there, do they call hemophiliacs bleeders?
Hemophiliacs?
A person with a bleeding disorder.
So many of the conditions, many of the conditions say a person with.
Right.
Unfortunately, there are a few. I've heard people call them bleeders, but I don't hear them calling them bleeders to their face. Okay. I think ours is probably the group that most often gets, termed sicklers. And when I used to talk with doctors about it, their thing was always, I don't know why you get so upset about it, And my thing was that they're not their disease. They are people living with sickle cell disease, and it's making it difficult to live well with sickle cell disease when you get all of the kickback from being called sicklers and malingerers and manipulators and frequent flyers and drug seekers and drug abusers and all the things that come along with that term sickler. And that's the only reason that I fight for people to push back when they get that, because I know what comes along with that, having been in the medical profession for a long time.
So why not start at the colleges? Because ignorance isn't created. I lie, I rephrase that. Ignorance is learned, right? It's not something you're born with. So if all of these doctors are having this issue and it's sit there reflecting on the patients, start with the actual facility, start with the university, start with the places that do the hands-on training, the medical hospitals and so forth. There's a lot of us that can go to the community centers and just spend a day and say, hey, this is our experience. 9 times out of 10, they plan the week that they're going to study sickle cell ahead of time. We can link up with some universities, start from there, teach people from now. A couple years later, hopefully, hey, the generation will change. The stigma will change. But what are we actually doing?
Jump in on that. Oh, sorry. Were you finished, sir? I'm sorry. I didn't mean to interrupt you, but you just really sparked something in me that I wanted to just not forget. I think that would be an amazing idea. I think you should. I'm a medical student, and we start off our medical education with a cystic fibrosis patient and learning about the structure of the pathogenesis of genetic disease and have them tell their story. And it would be phenomenal if we could do the same thing with a sickle cell patient. And I'd love to try to make that happen at other medical schools. So continue your thought. If I interrupted you, I'm sorry. You just got me excited.
Let's do it.
Well, Robert, one of the things I wanted to mention, like I hear everything you're saying, and Asi brings up a very good point. Like he's a medical student. It is about that educational piece, and I agree with it. I think the message that Pat Corley and Carolyn and everybody is trying to convey, which does actually correlate with what you're saying, Robert, is that opportunity, that moment to teach, right? We always have opportunities and moments of teaching. And if we're not going to take it upon ourselves to teach at every single, so for example, like we hear the term sickler. Are we just going to stand there and get angry and then think about what we can do to kind of change that in the future? Or can we take that moment right then and there to stop somebody and say, hey, don't call them a sickler, right? Because this is what happens to it. It's, just to kind of take my own experiences as being a Latino man, when I walk through life, people just automatically assume I'm Mexican instead of calling me Latino. So I have to take that moment and actually correct them and say, I am Latino. And then you ask me where I'm from. And then I tell them I'm Peruvian. And through that moment, they actually understand that, oh, just coming up and saying someone is of a certain country and not an ethnicity is just as derogatory as, anything else you could call that person. So it's about that moment to teach. And I think that's what Pat Corley is getting at. Instead of actually calling them a sickler, call them a patient with sickle cell disease or, by their name or whatever. So, and that kind of goes with what you're saying, Robert. It's that moment of ignorance that we have to take upon ourselves to either say, hey, we're going to let it slide. We're going to actually take this opportunity to educate someone and stop using a certain word in a certain way. And that's how you kind of start taking things back, Robert. And that's kind of leads to the discussions and everything that you're talking about and moving forward. So it's not about trying to do everything now or your ideas are great. I think the point right now is just about that one term, that derogatory term, because people use it in a derogatory way or an ignorant way. And if we're not going to stop and think about how can we educate people, then what's really the point of doing any of this if we're just going to worry about the next generation and trying to get them? If we can't make changes now, changes won't ever come back. So it's about taking that teachable moment and actually teaching someone something new. You can't teach an old dog new tricks. I've done it before. It's just about understanding what you're trying to teach them. You know what I mean?
Okay. So let me make this statement real clear, right? I appreciate you guys, by the way. I do not disagree with anything here that is being said. I think everybody has a voice. Everybody has an experience. All of our experience with sickle cell is different. Some of us, like I said, we're in the hospital week after week. Others of us can go a couple months. Some can go a couple years. Everyone's experience is different. Everyone's point is valid. I have no problem with anything anybody said. I appreciate it. I like hearing the different values. However, that being said, one of the biggest things with the sickle cell community, we're all talk and no action, and I'm honestly fed up with it. Like we talk about doing a whole lot of stuff. We talk about getting things here, getting things there, wanting this, wanting that, and my biggest question keeps asking, what are we doing about it? That's the main statement I'm gonna keep saying. I'll throw an idea out there. I'll make sure to sit there and I'll put ideas on the board, but if people aren't actually gonna follow through, what's the point of me speaking? I can continue to do what I gotta do out here. But I'm here and I wanna hear it. I'm not in Cali anymore, but I'm here because guess what? I want us all to be unified. So we gotta start doing something. Make a move.
So Janelle, you had something you wanted to share?
Janelle, are you on, or should we just read what you wrote?
So Janelle was sharing that she'll be teaching at San Francisco General Hospital, the nurses, about sickle cell disease, which is incredible, because then they get an opportunity to meet a person with sickle cell disease, you know, and hear what she has to share about sickle cell disease and her life with sickle cell disease. And Robert, thanks for what you shared, and your passion. And you know, I don't know how involved you are nationally with the sickle cell movement, but it's certainly an opportunity, and there is space for everyone who wants to participate in making a difference in sickle cell disease. And so I challenge all of you guys to jump into the circle that surrounds us related to sickle cell disease. But I also ask you on a more personal level, if you encounter people who you can, you know, teach. I still believe in that old philosophy of each one teach one, because if I teach you, then you can teach the next person, the next person can teach the next person. While we're putting together a way of teaching a lot of folks, we can at least impact at least one person to begin with.
Can I get in there real quick?
Yes.
Hey, so I haven't been involved too much in sickle cell, just to be completely transparent. I met Miss Nadina and Antoine in Sacramento at an event, and we just kind of been in touch since then. But I do know it affects Black people mostly. And Robert, what you were saying, I'm not at a place where I can say I agree with you, just because I haven't been involved and I feel like I can't really speak on that. But I agree with what you're saying in regards to a lot of times our culture or Black people in general, we talk a lot about a lot of issues, but then we're not as unified in creating action behind that. So I just want to ask what I can do to get the ball rolling, because I'm an action person myself. So if you got any couple of key takeaways I can take and put into motion right now, I would be happy to grab that.
So you put your hat in the ring, and you will be called on regularly.
Show up. Speak out.
Okay.
Okay. Because we need all the help we can get and making and enlightening and making a difference in the sickle cell world.
Well, I will do this. I'm gonna go ahead and put my email and my first and last name in the chat.
Thank you.
And if there's anything I can do to ever help anybody, that's a way I've been living for some years now. So even if, you know, it seems like it's out of place or you're not even sure, because I've got my own network, and then I've got a network that can look into things also. So whatever it is, if I can help you, I'm gonna help you. That's.
Sounds good. Yeah. We'll be reaching out to you.
Pat, just to give you guys a heads up too as well with Justin. Justin and I are working on a list of speakers for this program in 2021. So he'll be a very valuable piece of our organization, or actually our program for next year. So thank you, Justin.
Okay.
Of course.
Okay. So let's just go. let's talk a little bit about stigma, and how stigma does boil down to discrimination and hate, and it results in distrust, poor care, and diminished health, and ultimately loss of life. Because if you're not getting the things that need to be addressed, your disease process will continue to worsen. And once it gets to a certain point, in a lot of instances, things happen that cannot be reversed, in the sickle cell arena. And so that's one of the reasons that I really want to focus on stigma and people understanding what stigma was all about. So can we go to the next slide? So, and then post-traumatic stress syndrome, or disorder. We talk about that a little bit, but when I was researching the literature, because Adrian and I talk a lot about post-traumatic stress disorder as it relates to sickle cell disease, because almost every person that goes into the emergency room and encounters poor treatment, whenever we talk to them, they always say, I don't like to go to the emergency room because they treat me bad there, And so I just think our population should not be a population that has to worry about whether they're gonna go and get their challenge looked at, or whether they're gonna stay at home and suffer silently because they're afraid of what's gonna happen once they get there. And then when we're talking about post-traumatic stress syndrome, we're talking about, having repeated panic attacks every time it's time to go to the emergency room, or every time you remember the things that have happened to you. And so even though we don't call it post-traumatic stress disorder, it certainly mirrors the way it looks, although there's been very little research on the part of sickle cell individuals experiencing it. Is there anyone who wants to talk about their experiences related to the emergency room, or whether they even feel like they could possibly have post-traumatic stress syndrome?
I can certainly speak to this. I was diagnosed with PTSD as a result of a domestic violence incident. So I can definitely say with 100% certainty, my experiences in the ER with SCD are very, very parallel. It is the reason I do not go to the ER unless it is absolutely necessary, because all of those other experiences, the anxiety, the fear, the anger, all of that comes with an ER visit for me in many instances. My last ER visit, the most critical one I would say was in 2015. And the doctor literally ran my blood, said that everything looked fine. She just assumed I was drug seeking, and she was willing to send me home. What actually happened was I had walking pneumonia, acute chest syndrome. My heart was completely surrounded by fluid, to the tune of 20 pounds of water weight was added because of the fluid around my heart. But this woman was going to send me home to die. So for that reason, I don't go to the ER unless I absolutely have to, because I know I have to fight, I have to argue with people when I go, and it is exhausting. So I would much rather stay at home, risk overdosing on my medication, than to go to the ER and have a debate with somebody that went to med school. Like, it's something that we have all dealt with. I have yet to meet someone with sickle cell disease that has not had a horrible ER experience.
Mm-hmm. I agree with you there. Shoot. The ER is hands down the only reason I don't allow new nurses to mess with me. For those of you that have met me, like I said, you saw me in California. I came in bright-eyed and bushy-tailed. I was ready. I was like, okay, I'm here for work. I opened a school. I was excited. And then I went through 10 of your hospitals.
Sounds about right.
So yeah, your ERs. Oh, beautiful. Remember how long they told me, yeah, I need surgery, I need a whole new port. They wanted to cut me open for this, and this reason. And then Corona happened. And I said, deuces, no. I came back to CT. My original nurse came, looked at my chest, said, boop, boop, it's working. You don't need jack. So I will say, yeah, you get PTSD from these hospitals because I just went 2 years with them telling me surgery, 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 to the point that that's all I thought. So my wife thought. Now I'm home and I'm just like, okay, I'm back to working 4 jobs again. I don't know how the hell it happened, but I am.
Yeah, no, it is like that. Thank you guys for sharing that. You know, I've just with sickle cell trait, you know, dealing with doctors has always been an issue, and needles and their calmness, kindness, and softness has always been an issue for me.
Okay.
He says softness.
Yes.
I'm interested. Do you get apheresis?
What's that?
Do you get apheresis?
What's that?
I
have
think
the
about like a
trait.
blood transfusion, but maximum power.
No, I haven't. No, I haven't had experienced that.
I was gonna
But-
say because softness comes to an extent, but that's the one thing I don't think they could ever do softly. Take that news right in the chest.
Yeah. I mean, just with the trait, I had my spleen removed, and so just being in hospitals during that, the surgery and after, and how they're very rough. It's like, you know, I just came out of surgery, or I'm, you know, in here because I'm ill, and it's like very rough, hard, not very sensitive.
So did you think that they were that way because you had sickle cell disease, or did you think they were that way with everyone?
I don't really think. I just think that it was not how I was most comfortable in those situations.
Okay.
You know, in when I go to the ER, it's not from being on a place of comfort. So it's not necessarily that I thought or didn't think about others, but it was just about like, how am I right now and how's my comfort? And it seems to be a pattern with me. I'll just say with me, particularly in healthcare settings, that they are, you know, like, you know, I just got a flu shot, and I had them plenty of times. This time it was just like, I felt like the needle went all the way through my bone. It's like, why, how did you just do that so hard, or why?
So
There's little things like that.
So did you ask that question?
No, I actually just wanted to get out there as fast as possible because I knew it wasn't my doctor. It's not someone that I have to see regularly. So it's just like, oh my God, thank you. I survived. You know, my arm's still here. Let me just get out of here.
So I think I get in trouble a lot because I asked all those kind of questions. You know, or I make statements like, God, that really hurt. You know, what just happened? You know, so I think sometimes people do things and they don't have maybe they don't even know they're doing it. And so I think it's important to make them aware sometimes. You know,
I have a question for the young gentleman, right?
Mm-hmm.
Especially since we're talking about stigma. So I have full-on SS, right? Ain't no getting around that. But you said you have the trait and you had to have your spleen removed. So for my sickle cell community directly here on New England, there's definitely a stigma between those of us with full sickle cell and those of us with the trait, simply because of the fact of we've always looked at people with the trait as, okay, well, you got it, but you don't. At least you could be healthy. At least you can kind of live your life. Like we stuck here suffering. What you complaining about? So you're not the first person to tell me you've had some sort of health issues with the trait. And I'm kind of curious as to know, like, what is your experience as someone with the trait versus the full disease? Like, what do you see differently? What's your stigma, basically?
I mean, just talking about an issue with me in general is a stigma, which would go to mental health and being open advocating for myself. Just like I shared, I didn't say anything about this last interaction with getting a shot. And so am I not advocating for myself because I know I have other issues and pre-existing conditions that are not favorable to bring it up? You know, when is it favorable to bring up those things? You know, the only time I actually ever brought it up on my own kind of was after I made a collegiate basketball team. And that was, you know, speaking to a doctor because of, you know, physical health, having us run up and down with my blood cells and oxygen being a thing. I needed to monitor how hard I run and how much capacity I give so I wouldn't pass out. So other than that, that's like the only time that I've really shared. And like I said, in high school, when I did have that operation and when I was sick, you know, I went to a pretty small high school, only 100 people in my class. And so for the group of us that went, it was really hurtful to, for the first time in my life, be in pain, need help, not know what's going on, and be the only Black person or one of two Black people on the trip, the other of which thought I was kidding the whole time and further made fun of me for feeling sick. And so it's like, you know, people actually thought that I was pretending to be sick so that I wouldn't have to do the class activities and events. It's like, what? I came out here just to like be in the cabin? What do you mean? So it's like, even to that level, it's like people think, oh, you're just gonna come all the way to Venezuela and you want to stay in the hotel in the cabin, opposed to believing that, hey, I'm actually sick, I need help.
So, and I mean this with the utmost respect, right?
Yeah.
What makes you so sure that you have just a trait and not an actual form of sickle cell? Like, have you actually gone to get yourself retested to see if you might have, like, maybe you don't have SS, maybe you have like SC or something like that, but like, just kind of what you're describing to me, I've had sickle cell my whole life. I've been on damn near every board I can think of. I'm huge on patient advocacy, but I don't know. And again, this is all things we can learn. It's still a disease, but just when what you're describing sounds a bit more severe than the trait itself. You could have another form of sickle cell that either A, they haven't discovered yet, or B, maybe it is something they just haven't caught it right. You know, people are misdiagnosed.
So in the medical field, it's not unusual for people who have sickle cell C disease to be diagnosed as people who have sickle cell trait. So it is important for you to be rescreened to make sure that you have accurate information. You know, and I also don't want to you know, act like I don't believe what you're saying, but there's a lot of misdiagnosing out there. And so it would be beneficial for you to have rescreening done to make sure that it's not sickle C disease or sickle beta 0 thalassemia or sickle beta plus thalassemia or something else, you know, because there are many different forms of sickle cell disease. Anytime you have a gene for sickle hemoglobin coupled with any other abnormal gene for hemoglobin, you could have a form of sickle cell disease. And they manifest, you know, some very severe manifestations and some less severe. So it'd be helpful for you to just be rescreened just to make sure.
And I can say,
I appreciate that. Thank you.
I've been misdiagnosed like 3 times. I was diagnosed with thalassemia. Then I was diagnosed with, I don't have sickle cell at all. And then one time, some weird diagnosis of a combination that couldn't be possible. But I have accurate diagnosis now, but there's that potential to be misdiagnosed in terms of what sickle cell you have.
And I just want to say for us, as a trait carrier, and I was told I didn't have trait, and there were other cousins in the family that, and my other older brothers had trait. And as we were growing up, they would get sick, right? And I would get sick with them, which should have maybe been a clue. But I think that that's with trait, that there are side effects of having trait, and to think that there wouldn't be side effects or health things that come with that, I think is a bit illogical. So we all tended to get more infections. We were tired. We would have quote unquote growing pains, where we would just have these moments of weakness. So I think that now they're doing a lot more research, and I think that it's a good time for us to just keep track of what's happening. But for sure, and this is just, what would you call it, a natural study. So there are a whole lot of us in my family. And we've had like these health problems that the other cousins, the AA cousins, don't have, and certainly aren't nearly as bad as the ones with SC or SS. So go get tested, and you know, put your health first. That's all I can say.
Yeah, no, I thank you all for that, because as I alluded to it, you know, this happened, and I learned, particularly because I was out of the country and got sick, and they tried all these tests on me. I kind of shared my story in the alternative therapies, but it wasn't until they asked, like, do you have sickle cell? And I actually said no, because I had never heard of having that challenge, or I never had that issue before, even heard of it from my doctors. So to hear it in Venezuela was like, no, I haven't heard that, never been treated for it. And apparently I did, which is why they had to take out my spleen, or had the trait, which is why the blood cells attack the spleen. But you're right, I haven't been retested since hearing that news and just going with it. So appreciate everyone's support.
So just really quickly, we're going to take a break at 1 p.m. I just wanted to ask one question, and this is to, because since we do have a lot of RNs, doctors, and so forth on the call, I wanted to direct this to Asi. Asi's in a position where he's in that process of learning what, you know, Pat, you've done for years. Asi, do you, in your and what you're doing right now in your medical school, are they teaching you protocols around PTSD? Are you hearing a lot about that, or are you focused on more just treating patients? Asi?
Did you mean PTSD specifically with respect to sickle cell, or PTSD as its own diagnosis?
With respect to people just in general, because everybody goes to PTSD in a sense. Obviously, it's heightened for sickle cell disease, but I'm just asking, because if there's no protocol just normal, then obviously there is a glaring issue with the SCD community in their PTSD with relation to what people are learning. I'm just curious to know that question.
No, we learn about PTSD in our psychiatry rotation. There's nothing specific like with respect to sickle cell, like that would maybe come in residency, that kind of more nuanced training. There's just so much information that they try to cram in that there's honestly not enough time that's put on it, I think. But it's just, and it all depends on what you see on your rotation as well. So some people might not see any PTSD and some might see a lot. So yeah, it's all about what comes on the floors, what comes through the doors. But it is something that they could do better on, especially in residency, I think.
Yeah, I was going to ask that too, Pat, because it just seems like, you know, Adrian's brought up, and everybody in general has brought up this idea of education all around, and it seems as though PTSD is just not a function of education for people that are in Asi's position, learning to become who you are, Pat. How do you feel?
So I think it's something that we certainly need to explore, and we need to push hard on having it implemented, where we could maybe even develop a program and educate people about the effects of sickle cell disease as it relates to PTSD and encounters with the healthcare
But just being Black in this
system.
country, we have
Absolutely. Adrian just said, just being Black in this country, we have PTSD, you know. And so the sickle cell community who encounters the healthcare system from the time they're babies, you know, would stand to reason. I particularly, the young African-American males who are in adolescence in the healthcare system, particularly because they begin to find the nurses attractive and they make comments that get them into trouble and get them kicked out of pediatrics and into the adult population. So we really need to start looking at some of the things that surround PTSD and how we can prevent people with sickle cell disease from experiencing that, and how we can make people more aware of the fact that they do experience it.
Nice. Okay, so at this time, we are going to take a 5 to 10 minute break. This has been incredible. You actually, Pat, have kept us on an incredible roll here, which has been hard to actually take breaks. So we're going to take a break.
Sorry, Antoine.
In the meantime, what we're also going to do in the process of Kimball Torres is dealing a little bit with allergies, but he's going to try to take us through some exercises so that we can just kind of rejuvenate. So we'll take a break 12 to 12:05, and then when we get to 12:05, between 12:05 and 12:10, Kimball will take us through a short little exercise to re-energize us. Okay, guys?
Oh,
great.
Talk to you guys in
be 4 o'clock.
Yeah. Q&A will start at 1:30.
Okay.
Wait, what time is it there? It's about to be 4 o'clock.
It's 1 down here.
3 hours, okay.
Yeah.
You want a Coke or something like that?
Yes.
I'm stuck here. Is Miss Nadina still here? I see her husband. Hey, Scott. Scott, I'm trying to grow my beard. Trying to catch up. And all I got is patches, bro. Wait, let me turn the car on. I don't know, I can't hear you for some reason. Okay. Try talking again. No, can't hear a word he's saying. I don't know.
So Robert, are you Hertz's friend?
Hertz?
He's my friend.
Okay.
Hey, can you hear me now, Robert? Okay, everyone?
Yes.
I think I unmuted. Go ahead, talk to each other, Pat.
Oh, okay, okay. I think I've met you before.
Probably.
I think so.
Uh-huh.
Robert was here. Robert was working with me, Pat. I mean,
Okay.
he is fantastic because he is so inspirational. He learned karate. And so I had him come into the support group meetings doing demos. And it was fantastic, you know, it was just.
Yeah.
Yeah, and he had a little speech that he would say because his doctor told him that he couldn't do this, he couldn't do that, and he couldn't do this. And what happened? How old was it? How old were you, Robert, when you finally got a chance to do the karate?
I started at 5.
Yeah.
2 weeks to turn to 2 months. It's now 23 years later.
That's great. That's
Isn't
great.
it?
Yeah, because it's really important that when you have any condition to be able to find something that you can be good at. I went to high school, actually went to junior high school and high school with a young man that had sickle cell disease, who I didn't know had sickle cell disease until I became the sickle cell nurse, and I ran into him in our clinic setting. And I told him, I can remember we were talking, and I said, you know what? I have to share something with you. When we were in school, I used to think that you were lazy. You just didn't want to come to school. And I didn't know you had sickle cell disease. And he said, yeah, I was off sick. That's why I didn't come to school. But you know, you don't know those kind of things unless someone shares them with you. And my first experience was with sickle cell disease was when one of my classmates in high school, we went home for the summer and she didn't come back. And she died over the summer. And so that was my actual first experience with sickle cell disease. I didn't know anything about sickle cell disease until that point. And then after coming into the sickle cell arena, there were so many folks that had sickle cell disease that I had shared. None of us, I don't think anybody in the school knew they had sickle cell disease.
Just know whoever lost a job opportunity, I'm always hiring. Oh, back is killing me. It looks like I'm laying down. I am.
It does look like it.
My back's killing me, and I'm watching dirt, so they'll be fine.
Looks like you got the best seat in the house.
I wish. Headmaster gonna roll up and be. I like my headmaster though. I never have to explain to him I'm in pain. He'll look at me and be like, "Huh? Okay."
So who's your healthcare provider there?
Dr. Andamarian.
Okay. Okay.
If her and Dr. Juan didn't link up, I don't know what would have happened to me in Cali.
What hospital were they going to here? You went about 20. Which one?
I'm not asking.
I want to know.
Adrian is in the background asking, what hospital were you going to in California?
Oh, let's see. Went to San Fran General, went to UC Benioff, went to, what the other one start with the S? The big one
Sutter.
that's like St. Francis here. Sutter, yep.
Sutter.
Went to Sutter, went to someone in Berkeley, went
CPMC.
to, yep. I went through 10 different hospitals before I finally found Dr. Juan. San Fran, Sac, Oakland, that whole area, I was just like, I was being ping-ponged everywhere.
UC Davis.
That's
UC
interesting
Davis, yep.
That's interesting that you weren't able to find care out here. Just thinking about it, there, Genentech is out here. They're trying to make this like the biotech hub, Mission Bay, with putting Kaiser there and UCSF Benioff, and they're trying to make it like a biotech hub of the world, where I would feel like Silicon Valley and all this money is, Bay Area having money, technology, biotech. It seems like they'd have niche services like this.
Well, Jason, it's funny that you bring that up, because that's not really, because I came from biotech. I worked for biotech for about 4 or 5 years before I started what I'm doing now. It's more about the research and bringing in intelligent people and figuring out diseases and cures. Is bottom line, it's dollars. So they don't actually, so they come up with all these different cures and all these different products and all these different things that are meant to cure certain things. And then they're all about getting it to the hospitals for people to sample. So it's really not them actually talking to the patients or talking to the doctors and figuring out what are the best methods of delivery, what are the best methods of treatment. It's more about like, let me push my idea and see if I can make as much money off of it as I possibly can. So you're right, Jason, this is a hub for biotech growth, but biotech's main objective is research. It's not about treatment or care. So all they want to do is, how can I push the envelope to the next step? It's about evolution within their particular medications and their products. So they're not all about, the patient care, which is, as I said, coming from the biotech side, I totally get what they're about in terms of the research, but that's why I think it's critical that someone like SCAA kind of makes that connection and brings people together to bring both sides, so that they understand like what the other can do for each other. Because there's that huge disconnect.
So we're the missing link in that equation. It sounds like.
What slide are you on?
Exactly.
I'm not doing any slides. I'm just talking to folks.
Oh, but I mean, are you going to have enough time to show all your slides?
I think so.
Oh, okay, because I was asking Amy what slide number you were on, and she seven.
So why don't we advance to
So we're gonna go through. We're gonna take this time just to get. Taurus is gonna take us through a quick exercise, and we're gonna get right back to you, Pat. Let's go ahead.
Okay.
Yeah. All right. Let's do the exercise now to get it back. But yeah, good point bringing up, Jason, that whole biotech thing, because you're right. We are a biotech leader, but sadly it doesn't translate to care. So first thing we want to do when we're sitting down is we're gonna take our hands here. We're gonna press them together. And we're going to keep it at our face. And then what we're going to do is we're going to bring it below our chin and then bring it up to our forehead. Below our chin, above, up to our forehead. So we're going to do this for 10 times. Right now we're at 3. Coming up, we're at 5. Sorry, my allergies are acting crazy because of all this smoke. 7, 8, 9, and 10. Good. Now what we're going to do is we're going to loosen up our neck. So what we're going to do is we're going to take our chin, lift it up slightly. Then we're going to crunch down on our jaws so that we form a nice, good jaw grip. And then we're going to bring it down to our chest and then bring it up. Down to our chest and bring it up. So we're going to do 12 of these guys. So we're going to go for 12. You can go at a nice, steady pace. We don't want to go too fast because it'll give you whiplash. And the slower you go, the more strength you'll build in these reflexes here. So once you get to 12, we're going to stop. Good. Once we get to 12, we're going to work on our smiles and our traps. The way we do that, nice big wide smile, and then we rotate to one side, and then we're back. Nice wide smile, rotate to the opposite side, and then we're back. Big old smile, rotate to the other side, and then back. So we're going to do 6 on each side. Nice big old smile, come back. Nice big old smile, come back. Rotate, big old smile. Rotate, big old smile. Rotate, big old smile. Rotate, big old smile. Okay, you'll start feeling your cheeks are nice and relaxed, worked out. It's a good feeling. It starts activating those endorphins. All the stuff, all the musculature that you have in your face are geared towards that. The last thing we're going to do, we're going to take our arms, we're going to put it above our heads this way, so my elbows are even with my forehead. Then I'm going to bring them down in front of me and then bring them all the way back up. Down in front of me, all the way back up. Good. We'll do 12 of these guys. We're at 4. We're at 5. We're at 6. We're at 7. We're at 8. We're at 9. We're at 10. 11. And 12. Good job. Okay, before I start sneezing, that's all I got time for. So these little quick workouts here, you do that every time you need a break at your computer. I know a lot of us are stuck in quarantine working on our computers. Do those, like 3 sets of that. You'll feel refreshed, ready to go. And they actually get your blood work going through your body faster so that you can actually feel more alive and be more productive. The more productive you are now, the faster you can finish. So you can clock out at 4:30 instead of clocking out at 6:30. Keep living the dream, everybody, and stay healthy.
Right.
Except me with my allergies.
So Antoine?
Go ahead. Go ahead.
I'm gonna go to what is trauma?
Yes, ma'am.
So am I ready to start?
You're on and cracking.
Okay. So when we talk about trauma, we're talking about highlighting psychological trauma, anticipated stigma, post-traumatic shock, that's stress disorder, and strategizing for successful encounters with the healthcare professional and institutions. So psychological trauma has to do with damage to the mind that happens as a result of a distressing event. And our sickle cell population goes through a lot of those when they come into the hospital. They have to deal with encounters that they're having with, I can remember going to the emergency room, and there was a young person that was in the emergency room. And when I came to the front desk to find out where that person was in the emergency room, the clerk who assisted me said, "Oh, you're here for the frequent flyer who's here." And I was a little shocked at first, but then I decided this is an opportunity for American male and what that means to our population. So there's a lot of psychological trauma that goes on, and patients are seen in a certain way, which causes them a lot of trauma, and spoken to in certain ways that they shouldn't be spoken to. And trauma is a result that exceeds somebody's ability to cope or even to integrate, you know. So, and then there's anticipated stigma.
She froze. I think she's not there.
She's still in the list of participants.
Yeah, she just froze.
Yeah.
Well, now she's on mute. Unmute yourself, Pat.
Okay, can you hear me now?
Yes, we can hear you.
Okay. I don't know. It went away and then came back. So anticipated stigma is an anticipation and our expectation that one will be discriminated against during future encounters because of his or her sickle cell disease diagnosis. And you know, I hear patients talking about that a lot of times. They don't want to go to the emergency room, or they don't want to see this doctor because they don't like the way the things they say to them. So it's sitting back expecting to be discriminated against, and it happens a lot of times. So the next slide. So on this slide, I'm just kind of talking about what are some of the consequences of being stigmatized that trap people into a cycle of illness, you know. So depression and low self-esteem as a result of all of the trauma that happens, poor coping strategies, not being assertive, communication skill difficulties, family factors and relationship difficulties, care-seeking behaviors, sometimes resulting in delayed treatment and decreased quality of health care, decreased engagement in care, and adherence to treatment. We hear people talk all the time about non-compliant individuals with sickle cell disease who don't come to their appointments or do, you know, what their doctors expect them to do. And I think that happens a lot of times because people just get tired, you know. Poor health outcomes, social isolation, self-doubt and shame, avoidance, devaluation of their pain is a major one. Resulting in poor pain management and unjust disadvantages for people living with sickle cell disease. So the next slide is just, I think did it skip? So so strategizing for success. So what I wanted to do was really kind of talk to you guys about what you think we could do to help people become more successful with navigating the healthcare system and with using their power to make a difference in the care they receive and to ensure that they get what they need as they meet up and interact with people in the healthcare system. So I'm just kind of opening it up so you guys so we could just talk a little bit about it, and then I'll also share some of the things that I've thought about over the years and some of the things that I've encouraged patients to do. So does anybody want to share how you strategize for success? So in strategizing, I encourage people to to try and ensure that they get optimal care directed at being the best person that they can be, and using the healthcare system in a way that gives them a big yield rather than a way that they're totally frustrated in after being involved with the healthcare system. So I always tell patients to know and share your story better than anyone else does, because you're the only one that really knows what your life with sickle cell disease is really all about. And so preparing for successful interactions when interfacing with the healthcare public, can we go to the next slide, is some of the things that I like to talk to patients about is developing a personal portfolio about you and your life with sickle cell disease, and to share things about you and share your care that you've had in the past and what was the best care you ever had. And then the thing I like for folks to do is to share a photograph of them when they're in their normalcy with sickle cell disease, because I think that's really important for people to know who you really are, you know. And then I always tell my folks that I work with that consistency really matters. And so that means that establishing a good connection with your healthcare system and making sure that people know you. And sometimes that means that if you're hospitalized, if you're at a new institution or something, going back after you're out of the hospital and you're well, just to, you know, to speak with folks, to let them know who you truly are. And sometimes you get favor by doing things like that. And to always establish a medical home which ensures consistency in the care that you're receiving. Choose a hospital for care and go and try and utilize that all the time. I know it doesn't happen. Sometimes it's an emergency situation. You call 911 and you wind up at some other hospital, but even if that happens, able to reach out to your healthcare provider who can reach out to the folks at that hospital and actually give them the information that they need in order to take good care of you. And then to choose also not just a hospital, but a pharmacy as well. Because if you're going from pharmacy to pharmacy to pharmacy, pretty soon people are going to begin to look at you in a very different way. So if you have a pharmacist or pharmacy, that one as much as possible. And then when dealing with the hospitals, to always understand the chain of command at hospitals. Because I think oftentimes some of the stress comes from not really realizing how hospitals work. So you go to a hospital and the hospital is horrible, but you don't know how to complain about it or how to make people aware that you're having difficulty there. And one of the things I encourage patients to do, because sometimes you can't get to the key players, is to sign yourself up for the chaplaincy service. Because chaplains usually are pretty compassionate, and so they will get in there and fight for you in instances that you don't have someone else to fight for you. And so I always call the chaplaincy servants to assist me with patients. I ask the patient's permission first, and then I call them, because I need somebody who can fight alongside me to ensure that patients get what they want. And the other thing that I encourage folks to do is to present for treatment before your communication skills go down the drain. Because when you come in and you're in such severe pain, you know, because you waited 4 days to go to the hospital because you didn't want to go to the hospital, and all you can basically do is just try and make sure that you stay as still as possible and that you don't speak, because you're in so much pain. But for folks who haven't experienced sickle cell painful episodes, I haven't experienced it, but from descriptions that people that I've worked with have talked about, there comes a point where you don't even want to talk because the vibration of your voice is painful. And so I encourage patients to use to come in early enough where they still have communication skills, or to bring someone with them who can communicate their information. You know, you really probably should never go to the hospital without a support system in place. And then be prepared to describe and document and share your pain experience, what you're going through, you know, what it feels like. Is this different from what you normally experience? Because I think it's important for us to encourage people living with sickle cell disease to really, really become a storyteller of what's going on with you, you know, in order for people to really get an understanding. What's your usual pain pattern? Most people with sickle cell disease will tell you that my pain usually manifests in this way. And then to know your medications, your dosage, your, you know, what you're currently on, what you've taken in the past, what you've had reactions to, what you have a reaction and an allergy is a whole different thing. And to know the difference between having a drug reaction as opposed to having an allergic reaction is important. And then to know your dosage and what usually works for you when you're in pain, you know, and to know what does not work for you, and to not say that you're allergic to morphine because it makes you feel a certain way, as opposed to, you know, it just doesn't, I don't feel good when I take morphine, you know. And to share alternative treatments that you might be you might be using for sickle cell disease, because sometimes alternative treatments might get in the way of treating certain things that are going on with you. Say, for instance, you have a blood clot and you're taking some medicine, you know, that may alter that medicine that they're going to use. So you have to share all of those kind of things. And then Adrienne laughs at me all the time because I always tell her, together we can change the narrative about sickle cell disease and how sickle cell disease needs to be treated. But first we have to teach people to know your value so others can see, understand, and appreciate. And so that's always one of the things I push toward people really doing with sickle cell disease, because if you don't know how valuable you are, you'll accept a lot of things. So I'm going to just kind of open it up so you guys can just share some of the strategies that you use. So hopefully you can help other people to develop strategies that will work for them as they encounter the healthcare system, and just people that they need to teach more about sickle cell disease.
Well, one of the strategies I used in the past, this is before that 2015 incident in the ER, I would program the house supervisor. So whatever nurse was in charge had an on-call pager or cell phone. I would keep that number in my phone. So if I'm sitting in the ER waiting room for longer than 15 minutes, I call that number and I usually get an immediate response from the staff and I get care right away.
So what was that person's title?
The house supervisor. It's usually a nurse that is in charge of the facility.
Mm-hmm.
Perfect, thank you.
That's a good idea. Mm-hmm. And then it's important. I know probably most of you know that hospitals have an ombudsman. So it's important to know that as well, because you can always get some satisfaction from contacting that person as well. And then to know how to make formal complaints about things, you know, because oftentimes, you know that old saying, we have not because we ask not. And so when we encounter things that don't go well for us and we just go away feeling hurt and defeated, there's never going to be a change if we don't decide to be the change, you know. So
Yeah, I agree with that.
Folks to get involved in being the change.
If it's okay, I want to touch on that really quick.
Uh-huh.
You had a slide up, maybe two before this one that had I'm not sure if you're right before this one. This one right here. So for me, when you were reading this, and I just want to be transparent about this. I don't have sickle cell. Again, it hasn't something that has affected me personally, so I don't want to not acknowledge how difficult it is for you guys. But with this list, when I read it, a lot of these things kind of affect like the Black community in general.
Absolutely.
So I know that for a person going through, what someone with sickle cell is going through, is probably like twice or like 10 times as worse. Because if people in our community already feel like this and they don't have a legit illness, if you already were going to feel this way and then you have a legit illness on top of that, you probably feel even less empowered that you're in a position that can make a change. So the reason why I wanted to bring this up is because and please, anybody feel free to step in and correct me if I'm mistaken on something. But you mentioned, when we see these injustices or we see these things happening or we're not getting the care we need, that we should speak up about it. And what I've noticed is working within my community in general is we have a problem speaking up even when it's not necessarily our life or our healthcare that's not being treated properly. It could be something as simple as maybe your checks will at work or a significant other or relatives or siblings, and you're not comfortable standing up for yourself in that space. So one thing I would encourage or ask the team to consider, and again, people who are more experienced in your field, please correct me if I'm mistaken. But one thing I would encourage people to consider is just if you were listening to this thing today and you're reflecting in your mind like, oh man, I've had a couple of scenarios where, oh, I should have filed a complaint there, or man, I shouldn't have let that slide here. If you've noticed those kind of experiences, one thing I would ask you to consider is how many other instances in your day-to-day life do you kind of let things just go that maybe it didn't make you feel good about, but you just decided to let it go anyway, just because, that's how we're used to being sometimes. I've been a person that way, trust me. I would ask you to consider just making those small, putting your feet down in those small situations. Even if, of course, your health is wealth. That is the very most important thing that we have. Like she said, I encourage you to bring someone with you that can be your voice. Exactly, stepping out of autopilot, that can be your voice in the hospital. But what I've noticed with people is sometimes it's hard, or it's almost, I haven't gotten the best results asking them to make a big change if they haven't made the smaller steps in the first place. And for me personally, like I've kind of been going through some things this year, and I'll be real with you, man. My pops passed away earlier this year, and we had an ugly stint in the hospital, man. We spent 3 weeks in ICU. He cold blew a couple of times, so I got huge respect for people in healthcare. And I've always been a super driven person, but since that's happened, I've lost kind of that fire a little bit, and I was hard on myself about it, and I expected myself to go from at the bottom back at this high performing place. And I had to take a lot of steps back and realize how unfair and unrealistic I was being to myself. So I just want you guys to consider if you're noticing like, man, she's right, I should be, connecting with the I think you said the program director or the ombudsman or these people who I can reach out to and make things happen. If you're realizing that, also acknowledge with yourself if there are some smaller steps that you can make first. And to not just be hard on yourself if you're not doing these big things. It all starts somewhere. So again, with this list right here, a lot of us are dealing with this at home. Just start making some traction. Because if you're trying to go from not working out to working out all the time, start with taking a walk outside. Similar concept.
Yes.
So Pat, I had a question. So I might either be late or too early or some sort. So, and maybe I might need to, you tell me if I need to say this for the Q&A portion, but well, I think we're probably there, but so we have a young lady, her name is Delisha. She has a husband right now who is like getting worse and worse by the day because of sickle cell. They live in Sacramento. And she has a sister-in-law who has basically told pretty much everyone in the family that she's coming to grips with what she's dealing with, and she's just really not going to try to fight too much and just kind of let life take its course. Whereas that's like an opposite of what others are trying to do. They're trying to fight and keep, their lives, in good health and so forth. So for the loved ones, the people that are in relationships with sickle cell patients that deal with a lot of these issues, what can we help them with?
If I can get on the tail end after someone more experienced goes.
No, I'm gonna let you go first, and then
Well, actually, can I just jump in? There is free counseling from Be the Match, 8 free counseling sessions that they've offered to the sickle cell community and the family of persons with sickle cell disease. And if someone could just email me, then I could email that back out. But the community has found it quite helpful. It is free. There are 8 sessions. And even if you need more than 8, what patients have shared with me is that they're willing to even go that step further. And I think that acknowledging that a person needs help and that you can speak with someone, and the fact that this is free for our community, we need to take advantage of when these things come to our community, these resources, that we need to take advantage of them. And so they're available to not only person diagnosed with sickle cell, but also family members. So one step would be mental health.
Just to make sure that I got this, I don't want this to feel like it's a stigma in the conversation, but some of the people that I'm bringing up, for example, Delisha, they're white. They have no idea what, they just don't know. They understand their partner. They love them. They want to be everywhere for them, but they just have trouble truly understanding this Black person or this Latino person's issue, because there's not a lot of whites in our country that deal with sickle cell. Most of the whites that deal with sickle cell are in the Mediterranean. So I just wanted to bring that up too as well. There's a social construct to this whole thing too as well.
Yeah, I think sometimes we have to ask that person what they want to do as well, you know, and what role they want us to play in that, you know. And I think that we sometimes have to be, I can't say you're crazy or you seem crazy, but I can say you seem more sad than you normally are, or you seem more, you know, distant than you normally are. And I just think it would be helpful, you know, if we got some help to help us to get past here. But I think that we have to, you know, sometimes we want to fix people because it makes us feel better. But I think sometimes we have to reach out and ask people, you know, what they need from us. So I do think counseling is good. Again, I'm going to say I use the chaplaincy service because oftentimes, you know, they have a chaplain or something who has experience in that field. I just encourage people to talk and to share as openly as they can. And if I see a difference in who you've been in the past and who you are now, I have to work with myself to figure out how I can talk to you about that so that you receive it and so that we can get what you need in order to be better. I remember one of my first experiences with sickle cell disease was a young lady who was a Jehovah's Witness. And she actually was transferred to the hospital that I was working at, and they transferred her there because they felt like maybe we could convince her or we could legally force her to be transfused. And I remember I was quite young then, and I remember spending a lot of time, because we were about the same age, on how valuable she was and how she needed to take the transfusion so she could stay alive. And I remember her saying to me that that she wasn't going to take the transfusion. If it was God's will that she was going to die, she was going to die. And I actually went home. It was a Friday afternoon, and when I came back on Monday, she had died. But she had made her own decisions, and I think we have to allow people to make their decisions, but at the same time, assist them and support them as they make those decisions. So that's where, you know, where I am, you know, in my life, is that I want to offer the support, but I want to offer it with making sure that you're able to make a decision about it and making sure that it is the decision that you made. So I think counseling is important, but not everybody is gonna, our community doesn't do well with counseling.
They don't. They don't. And is it okay if I go on this one?
I mean, that kind of falls in that whole stigma that we're talking about.
Yes.
So we need to break that chain.
Yeah.
And support people in seeking counseling. And because it's difficult or weird or not normal, shouldn't be, we need to recreate the wheel. We still need to be innovative and creative, but we also need to, like we were just shared, take advantage of these groups and counseling sessions.
Absolutely.
Mental health resources, because as a group, we do not.
So I always sell it by saying all of us need someone to talk to who will not share our information with anyone else.
Like Black Panther, no one knew that man was sick for 4 years. That's incredible for him and his team, his family. No one to expose that he was sick. That's quite incredible.
It is. It is. So we do have to help our communities to understand that it's okay to have difficulty with things and to seek assistance.
If I could, I want to get on this one.
Okay.
Antoine, if you could you ask the original question one more time, please?
So we actually have some people online that are a part of this talk here, and then other folks that are just in our community that are struggling right now to help their partners to deal with some of these emotions that they can't necessarily get themselves out of or trapped in because of the cycle of illness. So the idea is just to get some feedback from you guys, because my mom talks to Delisha pretty often. And then there's some other folks that are not of our culture or just they know what sickle cell is. They understand what sickle cell does. They just can't live it. They've never lived it, and they're a different ethnicity to their partner.
And I think your other question was something along the lines of, it sounded like a person was kind of near the end of the illness, closer to that place where they might transition. And how do we encourage this person to keep going, or what the thoughts are around that?
Both of those. They correlate both, because some people are always in the hospital and their partners are just like, damn, I don't know what to do. I'm trying to figure this out. And then others are like, damn, I'm trying to keep my partner from dying. You know what I mean?
Yeah, okay. So I can speak on this one from my perspective. So what happened with my dad is he's been drinking real heavily over the last couple of years. And that lifestyle kind of really caught up with him. So I'm not sure if any of you guys are familiar with alcoholism. Unfortunately, the body just kind of starts to deteriorate. And it was difficult for me. And this is one of the biggest problems. So my dad made it through ICU, he made it to physical rehab, and he made it back home. So granted, there's going to have to be some changes in your diet. But to me, it's like, you've made it. Yes, you're behind of where you imagine where yourself would be. And I think a lot of patients can probably relate to this. You're probably not living the lifestyle that you envisioned for yourself when you were younger. So I can imagine that is like, can be depressing in itself. But with my pops, the way that I was looking at him, like he was 53, I'm like, you got so much more of your life ahead of you. I couldn't understand why he didn't have the fire and the drive to get better and get healthy and keep going. It was something I couldn't get it. Especially when I was a kid, he always instilled in me, try your best. Basically just do your best and just kind of lead the rest in God's hands, like to just never give up, never quit. And what I had to realize is what my dad was going through and what he felt, all these things that have added up over the accumulation of his life, the other hospital visits, the friends, the jobs, he was in the military. I know he lost some friends there. All these things that he had been carrying that he never dealt with, it was harder for him to deal with that. It was easier for him to let go and not have to deal with that than to deal with it and do the work to get healthy.
Absolutely.
And I had to realize that everybody gets to make their own choice. And even though I'm his son, and I'm like, yo, you're not even gonna, be here for my kids that I don't have yet. There's all these things I want to accomplish. I want you to be here to see it. And I was taking it very personally, which in hindsight, I'm not mad at myself, but I feel like that was wrong. Everybody gets their own choice, and everybody has a choice to live, or allow themselves to transition or what they want to do. And it's not our place to judge, or we definitely want to encourage people. We definitely want to educate people on their options, and we want to be transparent with them. Like I'm very glad I was real with my dad and let him know how I really felt. But we also want to acknowledge that, again, everybody's got their own choice. But a couple more things I want to touch on is, one thing you mentioned, Ms. Pat, was a person being receptive. And I realized that if I came in too hard on my pops, real, just kind of blunt, real straightforward, he wasn't receptive to me talking like that. And that it was better when I took a little bit more of, I don't want to call it coddling, but like a coddling approach, to where you're a little bit more softer, kind of go around to bring the issue up. We had a lot better, more engagement in those type of conversations. So your piece on being receptive is huge. Now, the other thing I wanted to talk about is that we're all limited in our own beliefs. And for me, if I see the world in abundance, that any opportunity that I want to have, I can create. You can take someone identical to my age, but had a way different upbringing or different scenario or different influences, that might not see the world in abundance. They might see it as they ain't got no hope and they're lucky to be their age, and that's basically as good as it's gonna get. And that's all dictated by the 6 inches between our ears. But the thing in the black community is we're raised by our parents or lack thereof, and the generation before that is in the same thing. It's just kind of this cycle that the best information isn't always passed down. So sometimes we're looking at the world with a limited mindset, but that's just because we've had generations of limited mindsets. So I don't fault people in that scenario. And a lot of times those of us who like to call it woke or whatnot, we like to condemn other people who don't see it that way. I think that's wrong too. But we're all limited in our own belief. And that's why I think it's so important to start early with our loved ones and with ourselves to try to see the world in abundance, and to try to see, I guess, the glass is always half full. Like my dad at 53, he might have felt like he was a failure. Like basically it's it, I might as well just let this go. As opposed to, realizing that you still got another 20 years that you can create almost anything with. Most people aren't experts in their field and been doing it for 20 years. You still got 20 years you can do that. And it's just a perspective, it's a mindset. So I think that's why it's important to talk to ourselves and talk to each other and talk to our young patients about having that kind of mindset and that kind of viewpoint. Because when things start to progress and you start to feel kind of sick, or you're kind of getting to that place, instead of feeling like it's almost over, I might as well go ahead and fade out, you might feel a little bit more empowered, like, you know what, no, I can't do this. This is, I knew this was coming, I was ready for it, and just kind of being able to build that way. But again, environments are going to influence the things that we absorb, are going to influence that, our parents, all kinds of things are going to influence that mindset. So I really don't want to come off in a way that if someone isn't feeling that way, but they're in that position, like I'm talking down here, I'm absolutely not.
Hey, Justin.
I just want to acknowledge that sometimes the way that the things that we've ingested, the language, the visuals, all that stuff play a role in our mindset in the long run.
Okay.
And sometimes if we're at the end, like my pops was, there wasn't anything I was going to do to convince him it was worth it to keep going. He had made his choice, his mind was made up, and he made his peace with it. I made my peace with it. I'm glad, I'm so thankful that I didn't lose him in an instant, and we had time to kind of do that.
Hey, Justin?
Yes.
Apologize for cutting you off. We just have a few more questions since we have a couple more minutes.
Yeah.
If it's okay, you could finish.
Oh no, I was kind of wrapping it up, man. I really don't want to come off like I'm talking down to anybody, but again, the mindset is so critical, and I think it's really the difference between a lot of the way we all choose to live, man. I mean, even not to kind of harp on this, but like when my pops passing, like some people, like I talk to them and they tell me like, oh man, like they're expecting me to be real sad. And don't get me wrong, I miss the guy all the time, but I made a choice to find the bright side. And a lot of people don't know their pops. A lot of people don't have parents. Some people are born with no family at all. And I had all those years I could absorb from him. And again, also I didn't lose him in an instant. You know, there was time. So to me, in most situations, you can always find a good way to look at it. And that just kind of keeps us all going in the long run. But yeah, if it's another question, I'll be happy to hear it out and share perspective.
I don't really have a question. I have more of a statement, right?
Apologize.
So
Is
I
it
took
all
the
right if
time.
Hold on, guys. Mervin, we only have time for one more question, guys.
Yeah.
I'm sorry.
Is it all right? We have a few more questions here. Let's see. So we have here, is there any statistical info or other info that reveals whether Asian, Indian, or Latinx SCD patients receive the same as treatment in the ER, in particular as African and African American patients?
This is for Pat.
It's for Pat, correct.
That's a good question. Huh.
Pat, are you there?
Pat, you're on mute.
From my experience over the years, it doesn't matter whether you're African American or Asian or whatever you are. If you have a diagnosis of sickle cell disease, there's still suspicion, you know, that you're there for drugs or that you're there, you know, basically that you're malingering kind of. And so I don't know that all people of different ethnicities get the same treatment, but I have seen a lot of them get the same treatment just because of their diagnosis.
And globally.
Okay, thank you. And then I have a following question. I have a next question. When you see training videos of past tense on sickle cell education, during the video, you've seen group support sessions where children are gathered to discuss their feelings and issues around sickle cell disease and living with it. Why aren't there many videos? Why aren't there many of those now? Who's normally responsible for holding those meetings? And do you know why isn't there an updated training video on sickle cell?
I can kind of chime into that one. So
I think a lot of those are done by. No.
Go for it. Go for it. Gotcha.
Go ahead, Pat.
I think a lot done by different institutions, and the availability of them depends upon that institution. And so I know we used to see more training videos, but I think because people are not quite sharing as many things as they used to in terms of being able to purchase those videos, and because we don't have the sickle cell centers that we used to have. The sickle cell centers drove a lot of those videos and things in the past, and so there's certainly a need for them, and we may have to recreate sources of making those videos, and so that we can train people to really understand sickle cell disease better.
Okay, thank you. Next question is the money from for pharmaceutical industry, or where is other money that motivates coming from?
My apologies.
Yeah.
Robert, did you have anything you wanted to add to that?
Just a little bit. We do have quite a few organizations that do those videos. A majority of them stem from the children's hospitals. A lot of the children's hospitals do a lot more programs than the adults. Why, I don't know, but it is what it is. So example here, we have Connecticut Children's. They're huge. They work in huge partnership with the Hole in the Wall Gang Camp. That was one of the first places where I got to see large groups of people with sickle cell. So session 6 and session 4, I believe, are the 2 sickle cell groups. And that's where I got to meet people from Egypt, people from Asia, people from Japan, people from all over the world with sickle cell, because that was the known organization here on the East Coast of these are the people you go to with sickle cell. These are the children. Let them experience life like anybody else. We got to do archery, horseback riding, the whole 9 yards. It was the one time you felt like a normal kid. But what they've done is Hole in the Wall, as well as CCMC, UConn, and the Citizens for Quality Sickle Cell Care Act over here have been huge on patient advocacy for these children to come out and do these programs. So the lead hematologists will always be the ones to come out and say, all right, this is the video that we're doing for this year. There's actual groups that constantly update these videos, constantly put it out there. The problem is there's not enough of us communicating with each other to get these updates. If you've seen on Snapchat, they've been having this guy advertise for a while. He's dancing for Sickle Cell Month, and he's asking people specifically, send in a video of them copying his dance moves, and it's all to raise sickle cell awareness. And that's a Snapchat ad. I just happened to stumble upon it. There's so many different organizations. It all comes down to the same thing. The children's hospitals, the parents right now are more unified than us as the adults. So we're not seeing a lot of these things, but kids, oh man, they smart as hell. They're more in touch than half of us. I'm telling you that right now. Let me go to my little cousin and ask him to find me something. He found me $1 million. I'm like, I just wanted that one.
They will put money there.
And
I think communicate with the kids, man.
oh, thank you. And my final question is that I have here is, how do you document pain experience?
So what do you, tell me exactly what year that question.
Sorry, you're cutting off, Pat.
Might have lost Pat.
Unpopular opinion, but I don't think we should document pain experience. The only reason I say that is because while we have a lot of similar pain crisis, like one the top 3 I've always heard when I'm in the hospital, oh, is it the throbbing one, or is it the one where it feels like somebody's grabbing you and squeezing, or is it the one where it feels like pins and needles? So those are probably the 3 most common. Those we document. But because we have so many different variations of people with sickle cell, the types of crisis that be coming, I just think that, me personally, if you try to start documenting it, you're gonna have a never-ending book. Because you could have somebody tell you, yo, it feels like I got polka dots and my blood is just bubbling up. Like, you don't know. And we can't just keep going off the majority, because that just puts people back in the mindset of, oh, because I studied it in the book, I know it better than the person talking to me about it. And we can't continue that mindset. Each patient's experience is gonna be different. We can make a couple guidelines for the big 3, big 5, whatever. But aside from that, the documentation of it is the part that throws me off, just because of the fact that I'm like, okay, somebody's going to run into a situation of, well, maybe it sounds a little closer to this. And they're going to look you dead in the eye and say, yo, if I told you it's this, why are you trying to tell me it's something else? We've all run into that problem.
So I really think documenting of pain is pretty much done individually, and people formulate their own words for describing their pain, is it stabbing? Is it, searing? Is it this? Is it that? But I think the biggest part of explaining your pain is to explain what is a functional level for you and what is not functional. So you come into the hospital and your pain is 10 out of 10. So at what number are you better enough to think about returning to your life at home, And I think it's really important for us to teach people how to share that kind of stuff, because I can tell you what the pain feels like, but I need to be able to tell you at what point I no longer need the services of the hospital, and I can actually manage my pain.
Okay, I can agree with that. So if that's the case, for each doctor's quote unquote pain plan, why not make that your specific pain plan? And then
to do, because I want them to. I'm sorry.
No, you continue. I was just stating that you could add that into each person's pain plan, since that's what they want us to do. Is what do you need your pain plan to be for you to get back on your home meds, Lord, and to get back onto your home care? You can actually you individually build your pain plan versus doctors individually describing our pain. I can agree to that one.
All right.
Yes.
Well,
yeah.
Thank you.
Yeah. I think they know how hard they have to work if you give them that information. Otherwise, they're going to just keep trudging along the way they're trudging along. But if I say to you that, I really don't like coming to the hospital, but my pain is at a 10, and so I have to come to the hospital. If you can get me down to this number, then, then I'll be able to go home, and I'll be able to manage my pain. But I think oftentimes we don't encourage patients to share that kind of information. And it really is relevant and important for other people to understand your pain experience.
Yeah. Awesome. Well, thank you everyone for participating. Well, that's all the time we have for Q&A. I'm going to transfer this over to Antoine.
Okay, guys, so really quickly before we wrap, just want to go through a few quick updates with the organization, just so everybody's always in the know. I want to make sure everybody's always in the know. The first thing, it's a good segue. Pat, you talked about the pain situation. I want to just give a quick thanks to Nina and Aiden. Aiden, those two ladies have been doing an incredible job of producing a journal that we're going to be passing out to all of our patients. Aiden, you want to give them just a little piece of information on that?
Sure, absolutely. So we're creating these custom self-printed journals that will have a bunch of space for you to document ER visits and things like that, but also have dedicated space for the things we've been talking about today, like pain plans, like information from the provider, like medical history, and like anything that is important for you to be able to communicate with someone in the ER, even if maybe you're not able to speak in that moment. So we'll be distributing those in the upcoming future, and we're really excited about that. Thanks, Antoine.
Definitely. Next thing, we got our website. Lawrence, could you give us some updates on that really fast?
Yes. Let me share my screen real quick. Okay. So on the website, we have our walk coming up, and you can start registering on the homepage where you see the register now button. And we also put up some new information about from the CDC about wearing a mask and how you should wear it correctly. And we also have new information about our AEP sessions, like where we can register, and also the YouTube video for our previous sessions on there too. Yeah. And Pat and Carolyn, I just want to ask the question, is there any like legislation links and new information about the legislation we can put on the website, or you can send me?
We'll send you stuff.
Yeah.
Okay, cool.
Thank you.
Excuse me, I have a question about the walk.
Okay, yeah, and it's good that what's your question, Robert?
So how do you guys plan to have people, I don't want to say overseas, what's the word? Non-Californians, we'll say, because I can't think of the word I'm looking for, participate. And virtually. The reason I bring this up is, you said virtually?
Yeah, we're doing virtual and in person. So okay. Yeah.
The reason I bring it up is because you guys told me to try to swing by. I did look up a couple tickets. I was gonna bring my sickle cell group, my headmaster, and a few of us. And when we went to go follow through on the process, we were stopped and warned that anyone going in and out of California must be quarantined for 14 days. And that became an issue. We expected to go there for a weekend, go be part of the walk, go see what needs to be handled. Maybe I'll check my office out. And I just can't spend 14 days in California. And it's the same thing. My wife's trying to leave to come back here. All goes well. We're having a baby soon and all. And she can't leave because they're talking about the quarantine and how I'm high risk, and she's basically leaving out of the hot zone to come out over here. So what's the plan in motion there,
Well, the CDC has currently lifted that ban for California, I believe, and maybe the nation. But and that was like over the last couple days, because I was dealing with that too and couldn't travel because of the 14-day a couple weeks ago, but that has now been lifted. But health, safety first.
Got it.
And so, yeah, as I was saying, yeah, you can do it virtually, Robert, if you guys can't make the trip. We totally understand. And we also recognize, with this whole COVID issue, that people are a little paranoid. They don't want to travel. They may not want to be around a bunch of people. So we opened it up for the in-person. I didn't really think we were going to get anybody, but 55 people want to come. So We're going to pull it off with social distancing. I just wanted to reiterate that normally it's at the Bayview Opera House. Unfortunately, they won't allow large gatherings there. So we've relocated to 1307 Evans. So if anybody's thinking about coming to the walk, we will have registration set up there. We will be doing social distancing and, you know, like Antoine said, taking all the necessary precautions, because we don't want anyone to walk away and say, wow, I bet you I got sick at that walk or something or another. So, and not only that, what we're doing is people that are coming with one or more persons, you know, that's their group. That's who they're walking with. And people that come alone and they don't want to walk with anyone, then they don't walk with anyone. We've got support from the fire department. They're going to help us with that whole issue, and the police department. So I suspect that things will go well.
Wow.
But I just wanted, like I said, to reiterate, the venue has changed.
And to piggyback on that, Robert, for those that do virtually, if you didn't hear earlier on, what we're doing is I'll be hosting it, and what I'll be asking for everybody to do is pick out their own route to where they want to walk if they're going to do this virtually. And we've calculated the amount of steps that it's going to take to complete what our walk actually is. So we'll be encouraging you guys to take the same amount of steps, whether you have an Apple Watch or anything that can help you count those steps, or at least we'll give you an idea of what the distance is. 2.5, or I think it's a 5K walk. So if you can think of what 5K in terms of distances, that's what we'll ask you to walk. But we'll be encouraging those types of instructions on the virtual so that you have an idea of how long you should go in order to keep up with what we're doing. Cool?
You guys have like a, what's the word these kids use nowadays? Like
Zoom
a
link?
hashtag all set apart and all that?
Mervin is actually our IG guy, so he's working on that. We don't have a Twitter yet, but we do have an IG.
No, not necessarily a Twitter. Like there's a, like when you have trending terms and all that, let's say I get a group of people to do that here in the CT. You would have like a specific term, so when it starts to trend, I could connect my term with your guys's, and you'll get all the pictures and uploads that we did from it, because it'll all connect in one little circle.
That'll be something we'll be looking in.
Done it.
I wanted to just make sure that we got one last update in. Kristen, she's our video coordinator. She's working on our YouTube channel.
Yeah, so I just want to reiterate that we have a YouTube channel, like Anton said, that's continuously updated with our AEP sessions. And so this one today, it'll be uploaded onto YouTube, so then you guys can rewatch and share. I just want to say that we're diligently working on our page to expand the types of videos besides our AEP sessions, with hoping to include like educational tips and other resources. So if you guys have any suggestions, like you can email me. I could drop it off drop it in the chat. My email address. Just let me know any suggestions you guys have. But I just want to bring it back to like today's session, since we talked about the lack of sickle cell education in our community. And as a video department, our goal is to use the power of videos to end the stigma and change the perception surrounding sickle cell anemia. So if you haven't yet, please check it out, give it a like and subscribe, so then we can actually push our channel on the YouTube algorithm. And it's a way for us to provide you with the most updated information. If you already have those done, like that's awesome. But I would also encourage you to share your videos with your friends through like Facebook, Instagram, Twitter, so that we can expand our reach and spread the education that we need right now. And I believe change like starts with using our platform to correct the negative mindset surrounding this disease.
Thank you,
What's
Kristen.
AEP?
The advocacy and empowerment session, training sessions.
That you're in right now.
This meeting right now.
Never knew the name.
This meeting is an AEP meeting, and we have nine months of these, so one per month for 9 months of AEP sessions.
Got it. So I just wanted to give you guys a heads up too, just so you know, Kristen Fung, our video coordinator, she's an Asian American. She went to Wallenberg a few years back. I mean, before she got to UCLA, she actually helped coordinate a way to get sickle cell implemented into the curriculum for biology courses at Wallenberg High School. So
Oh, that's what's up.
you know what I'm saying? putting in work.
Yes.
Mervin, lastly.
Yeah. Hi, Pat. I was gonna ask if you would like to be, if you can be interviewed and share your story, so that we can also put your story on our website, so that way whoever passes onto our website can also see that there's, you know, your stories. Oh, perfect.
We're trying to
finish my
what our main goal here, Pat, and everybody else, our main goal that Mervin's trying to execute here is we want to start giving sickle cell patients a platform. You guys have a big voice. We've got so many media platforms, and we need your voices on those platforms. So if you're not going to put them inside, if you're suffering with PTSD, or you're struggling with feeling like your voice is being heard, we're that resource that's going to help you get your voice out there, so that you're that much more powerful day after day. And that's what Mervin is trying to do: get as many of these stories as possible, whether it be in a patient or somebody that's working in the field of helping our community. You guys are giving us that momentum and that power. Edina?
Elon, I would like for you to be available for a testimonial. So let me know what your time is like next week, and we'll do an interview with you.
Okay, doke.
Great.
So back to
Medina.
Sorry about
Am I
that.
supposed to be on all of these?
I'm sorry?
Am I supposed to be on all of these? I'm just asking so I know.
What, I mean, all the sessions?
Yeah.
Yeah. Yeah. You left me, man. You have to be. I mean, what can I say? You know, I'll let you miss one or two or something. You know, if you're sick, better be sick.
All right. So I'll start putting the time. You might have to do like you did today. Just hit me with that reminder. I got you.
Yeah, that's what I did. I was doing that while we were waiting. I was just texting everybody, sign on now, because I made calls earlier in the week as well to a lot of people living with sickle cell to try to say, hey, get on, because, you know, Pat's going to have some really good information. It's going to be all about you, you know. So I appreciate all those that participated, and I'm certain that, you know, there was great value that you all received from this information. And I'd like to thank our sponsor, Global Blood Therapeutics, for their support and funding of this program. So just know that we're trying to do all of those things that we've been talking about with, you know, educating and why awareness is so important, and why advocacy and empowerment is so important. So, you know, we need to come together, like Robert was talking about, and work as a unit, because they need to see people living with sickle cell. You know, me and Pat and Adrian, we've all talked about taking a bus to SAC with a whole lot of the sickle cell community. So, you know, I'm not the only one that's living that wants that dream to be a reality. So, you know, there's a lot of people on board, and we need your support as well.
We're going to be able to access the replay of this quickly?
I'm sorry?
Or are we going to be able to replay this, like for Solomon, who couldn't watch much of it?
Oh yeah, you'll get the recording, you get the slideshow. Yeah, you get everything. Everybody gets that. Everybody that shows up gets that.
Okay, great. Thank you.
So no worries.
And that's on our public YouTube. That will be on our public YouTube page as well. So please feel free to share widely. I am going to take this moment. Now we're 11 minutes after 2, so I want to be really mindful of time and respectful of all of your time.
Yes.
I'm blown away by this meeting and by Pat's words and just the amount of participation we had in general. I learned so much, and I just feel really grateful to be a part of this. So thank you all for your input, for being here, and for your dedication.
Thank you so much for watching the AEP session all the way through. Also, thank you, Pat, for informing patients and the general public about sickle cell disease and strategizing better success for better care. Some key takeaways from today's presentation: learning about the consequences about stigmatization, PTSD, and trauma, strategizing success for better care, self-advocacy, and personal perceptions of good care. To watch more of our AEP sessions, click that subscribe button and give this video a like And if you haven't checked out our website, you can go to www.seaasf.org to learn more about our organization, as well as our bi-weekly newsletters and events going on. Now, let's make it happen, and let's change this perception.